awkward situation, but when you start talking, then they will realize they need to see.
My minister has seen you a lot of times.
Sorry?
My minister has seen you a lot of times. I'm taking dances, so she knows they are delaying things.
Okay. But you should just say, oh, you're welcome, we'll be starting soon.
Welcome to the third day of the conference. We need to get started. We have lost a bit of time, but we'll still make sure we catch up. And the guidance is that we make sure we finish by 12 o'clock latest. So let's make sure the presenters and the session chairs try to manage time as much as we can. We always start the day with a word of prayer. I would like to request Sister Lillian Mwape from Zambia to come and open today's session with a word of prayer. And today is being chaired by Zambia. So immediately after the word of prayer, I will request the session chair to take the podium. Thank you.
Good morning. Shall we open our hearts in prayer? In the name of the Father, the Son, and the Holy Spirit. Amen. King of glory, we want to thank you for today. We want to thank you for the gift of life. And we want to thank you for you are a faithful God. You have seen us through this day, and you are always with us. As we start the day, be with us. Give us the grace and divine wisdom, so that as we deliberate in the good of the region. Indeed, O Master, there are a lot of things we'd love to ask, but through our trust in Jesus, we say amen.
Thank you so much for that prayer. Distinguished guests, let me just say all protocols observed. I'll take you through this session, number 10, on the strengthening capacity for diagnostics in East, Central, and Southern African region. I'll be doing this on behalf of the Minister of Health for Zambia. Distinguished guests, accurate and timely diagnostics play a key role in disease surveillance, treatment, and prevention, ensuring effective healthcare systems. Most countries in Africa, in the East, Central, and Southern African region, are burdened by high rates of communicable and non-communicable diseases and are faced with persistent challenges in diagnostics, including limited laboratory infrastructure, shortages of skilled personnel, inadequate capacity for maintenance and calibration of laboratory equipment, inadequate supply chains, and lack of integration between diagnostic services and national health systems. These challenges are complicated further by various health threats, including emerging and re-emerging diseases, antimicrobial resistance, zoonotic diseases, and the effects of climate change, which demand robust diagnostic systems to ensure early detection and response. Hence, the session objectives are to share and highlight efforts, achievements, and challenges in strengthening diagnostic capacity in the African continent, and to showcase ECSA HC supports to countries to strengthen diagnostic capacity in the region. And then the third and last objective is to make key policy recommendations to ECSA HC member states' health ministers. At this moment, allow me, distinguished guests, to call upon the Honorable Minister of Health for Uganda to give a statement. Thank you.
Wow, thank you so much for the welcome you have accorded me. The Honorable Minister of Health in the Republic of Malawi, my colleagues, honorable ministers, distinguished participants, ladies and gentlemen. Allow me to stand on protocol as earlier said, mindful of time. I wish you join me to thank His Excellency the President of the Republic of Malawi, the entire government, the Malawian population, for the hospitality that has been accorded to all delegates and for making this conference a success. If you can put your hands together. Thank you so much. To the organizers and the partners, we can't thank you more, and we can't take this for granted, but we want to thank you for this meeting, and it is with great honor that I stand before you today to share the significant strides we are making in improving diagnostic capacity in Uganda. Accurate and timely diagnosis is critical for effective treatment, improved patient outcomes. Through a series of strategic initiatives, We have taken decisive steps to strengthen our diagnostic capacity and ensure that every Ugandan has access to quality health care. Allow me to highlight the few initiatives that we have so far undertaken. So far, Uganda has got 79 laboratories that have been registered, and it's not only into registering, but strengthening human resource capacity also. Uganda has developed a real-time national laboratory network, approximately 2,000 from national to community level. In Uganda, as I said before, our policy now is from top to bottom. So we go to the communities. And I want to say that in the strengthening and investment for human resource, Uganda has really put in much resources to ensure the upskilling of our health workers through scholarships supported by the African Development Bank. We have trained the most consultants in different areas and capacities in medical and laboratory. Additionally, we have conducted in-service training workshops across the country to enhance the diagnostic skills among health workers. Enhancement of quality assurance and accreditation. As I have said, we have accredited so far 79 laboratories across the country. We have enrolled the laboratories to extend quality assurance programs such as the UK National External Quality Assessment Services and the World Health Organization strengthening laboratory quality. All this is intended to strengthen our laboratory capacity. Upgrading laboratory infrastructure and equipment is another achievement Uganda has done. To enhance our diagnostic capacities, we have expanded and modernized our laboratories. For example, Uganda Cancer Institute has established a fully operational pathology laboratory, and Uganda Cancer Institute is now the center of excellence. You don't need to go to abroad, but just cross Uganda and you get the best services, the best laboratory services. Upgrading the infrastructure, as I have said, we have also introduced pathology services in collaboration with the American Society for Clinical Pathology, allowing remote consultations with experts. Expanding infrastructure and partnership. This is very important for all of us member states. We are constructing a state-of-art diagnostic laboratory supported by African Development Bank again to house cutting-edge diagnostic and research facilities. In addition, we continue to strengthen collaboration with institutions such as Makerere University, the Fred Hutchinson Cancer Research Institute, and University of Cambridge to enhance our research development. Integrating national and regional laboratories, as I've already alluded to, is another way of achievement. Recognize that laboratory capacity building must be of a broader national, regional effort. I am pleased to note that Uganda is not only part of the newly launched integrated laboratory systems strengthening, but we got support of $5 million initiative and our National Health Laboratory Diagnostic Services, which has been selected to coordinate this initiative for the Eastern, Central, Southern, and Africa region. Clap for us. That is a big achievement. This is not only for Uganda, but it is for all of us here. The initiative, supported by the Global Fund and the East, Central, and Southern Africa Health Community, will enhance diagnostic services across 21 African countries, covering critical areas such as antimicrobial resistance, surveillance, pandemic preparedness, laboratory quality management, and equipment maintenance. Uganda's leadership in this initiative is an affirmation of our long-standing commitment to laboratory excellence and regional health security. I wish to emphasize that our selection to coordinate this project is not because we have all the resources, but because we are committed to sharing our experience and lesson learned in dealing with frequent diseases, outbreaks, and diagnostics challenges. You are all aware that Uganda we have gone through a number of pandemics. Ebola, I think now we are in Ebola 9 or 10, but we are experts in early detection, management, surveillance, and we work together with all stakeholders. In managing pandemics, we are an expert now. I wish to take this opportunity to call all of you member states and everyone to come and benchmark in my country. I'll be leading the exercise. You are most welcome because we have cross-border diseases that we need to share our experience with you. I wish to emphasize that our selection to coordinate the project is not because we have all that takes, but because we have strengthened our partnership, collaboration, network with each and everyone here and across. I also must note that challenges such as limited genetic diseases, testing and outsourcing of essential diagnostic services to foreign laboratories remain widespread. By leading this initiative, Uganda is committed to addressing these gaps, not only with our borders, but across the region. We have done more achievements when it comes to national leadership, and this is the achievement that the leader, who is the Commissioner for Health Services and the Laboratory in Uganda, was selected to be now the chairperson of Laboratory Directorate of African Continent. Another achievement. Clap for us. Wherever there is an achievement, we must also share the achievement together. Thank you so much. And provide strategic leadership and condition. Our national reference laboratories for specialized national references laboratories, Center of Public and Health Laboratory are strengthened. National TB Reference Laboratory, we are also Center of Excellence moving. National Microbiology Reference Laboratory and Uganda Virus Research Center Institute among them. Referral and specialized hospitals, we have so far moved to several of them in our place, so we don't need to go abroad. Regional and district levels, as I said, we moved down to the community, 16 laboratories so far from what we call the health center 3, which are lower, to health center 4s that go to the hospitals. This is done to decongest the patients. Outbreak response disease investigations are conducted by a conditional team, including UVR, CPH, and Central Emergency Responses. Surveillance and laboratory has been enhanced and strengthened, and we are now moving towards into being a center of sharing. Lastly, but not the last comment, national laboratory sample transport networking is very important. National equipment is important. National bioresponse is important. National external quality assessment program is important. Laboratory management information system is also another issue. I wouldn't want to say that we are only doing this for Uganda. I want to say contribution to the African continent. That's why we are here. As I wind out, Uganda's diagnostic capacity benefits the entire continent in 3 key ways. First, rapid outbreak containment, swift detection, and containment of outbreak within Uganda minimizes the risk of spread to other African countries. Regional diagnostic support, Uganda provides testing services to neighboring countries, exemplified by the National TB Reference Laboratory support for TB surveillance in Somalia, HIV, and viral roadback for South Sudan include outbreaks investigation. Capacity building and technical expertise, Uganda shares its expertise through training and technical assistance, the National TB Reference Lab, Supranational Reference Lab, and supported 28 countries in developing their national TB laboratories. Uganda experts have also assisted with Ebola outbreaks in DRC and West Africa, and recent Marburg outbreak in Rwanda. As I conclude, I want to say the road ahead. We have not achieved everything we need to achieve, but at least we are part of those ones that are walking the talk. We have left where we would talk and lament, I was told, me I'm a Muslim, that even in the Christians, the book of Lamentations was removed. So we have to go into action. Looking forward, we are committed to further expanding molecular pathology services, establishing a genomics laboratory and achieving international accreditation for our diagnostic facilities. Our leadership in the ILFCC project will further strengthen regional laboratory networks, ensuring diagnostics excellence, sharing across Africa. The success of this project will not only improve laboratory outcome, but will have a broader impact on health system, preparedness, and the well-being of our population. The contribution of what we have done is so highly, and ladies and gentlemen, these efforts mark a significant milestone in our mission to strengthen diagnostic services in Uganda. The government of Uganda, in collaboration with the dedicated partners, remains steadfast in our mission to provide accessible, high-quality, timely diagnostic services for all Ugandans, and to lead Africa in building resilient laboratory systems. We can only do this when we are together, and together I know we can achieve it. I thank you so much for listening to me.
Thank you so much, Honorable Minister for Health in Uganda. We'll proceed to have a presentation on ECSA HC support to countries to strengthen diagnostic capacity by the ECSA Secretariat.
Honorable Session Chair, Honorable Ministers, ladies and gentlemen, let me just start by recognizing indeed that Uganda has really provided leadership in strengthening diagnostic capacity on the continent, and we are most grateful for the role that they are playing. My name is Andrew Silumesi from the ECSA Secretariat, and I will highlight some efforts that the ECSA Secretariat, working with partners, has been making in enhancing diagnostic capacity on the African continent. I'll start with this saying from the Association of the Public Health Laboratories, and this was made during the COVID-19 pandemic, saying that testing remains an important tool in our toolbox. Robust public health laboratory testing, clinical lab testing, and rapid testing are all critical to helping slow the pandemic. This was true then, it is true now. It underscores the importance of the lab system in pandemic preparedness and response. The ECSA Secretariat has been providing substantial support to the member states as well as many other countries across the continent to strengthen their diagnostic capacity. And this has mainly been through a number of projects that we have been implementing over time. And I cite some of them: the East Africa Public Health Lab Network Project, which was implemented up to 2015. The Regional TB Lab Strengthening Project is current, supporting 21 countries. The Integrated Lab System Strengthening Project, which the Honorable Minister Uganda referred to, started last year, July, and will be on for the next 3 years. We also implemented the Southern Africa TB Health System Support Project, and there are two others that are were implemented recently: the Strengthening Pandemic Preparedness, and an ongoing one, which is the Project Stella, implementing the peer-to-peer learning initiative. The idea is that countries are making tremendous efforts in enhancing their lab capacity, but the regional efforts are there to catalyze what the countries are already doing. And we have seen the country efforts being enhanced by this support that is coming from the regional level. There we see the vast extent of the support that is being provided, covering all the ECSA member states, but beyond that, up to 21 countries across the continent, going as far as West Africa, as you can see that little green dot representing Liberia. How do we do this? There are a number of implementation arrangements that are in place to help us implement the projects that we have been implementing. And here I give an example of the TB Lab Strengthening Project, which is supported by the Global Fund. ECSA is the principal recipient of that fund, but working with the Uganda National Health Laboratory and Diagnostic Services, we extend that support by leveraging on the technical expertise that we have in Uganda to provide support to many countries across the continent. And there are a number of approaches that we have been using to achieve this, which include the provision of technical assistance, and the visits have been either short-term visits or long-term visits, training, proficiency testing, benchmarking, which the Honorable Minister referred to, as well as peer-to-peer learning, which is something that I will come back to, and we are really seeing the dividends that it is paying off. And there are a number of focus areas that we are addressing, and these were alluded to in the Honorable Minister's speech, which include quality improvement and lab accreditation, equipment maintenance, lab information systems, integrated transport, sample transportation, as well as the all-important area of lab leadership and governance. I would like to illustrate one particular impact that we have seen in the support that has been provided in one of the projects that we have been implementing. In 2015, we carried out a baseline assessment to see where the labs were at that time in terms of their progress towards accreditation. The red and the yellow is really showing that those countries were remaining behind. But as we continued to implement the project, a few years later, we see how many countries are becoming green there. And by the time that we were reaching 2021, many of the countries that we're supporting had achieved those benchmarks and milestones that had been set in terms of labs progressing towards accreditation. This really just underscores how this support that has been offered through ECSA and the partners has been helping the countries to increase their capacity. One particular issue that I would like to mention is the support towards establishing supranational TB reference labs. Not very long ago, we only had Uganda in the sub-Saharan Africa region being the supranational TB reference lab. This was followed by Benin, and then we have two other countries, Egypt and Algeria, in the northern part of the continent. But we have realized that it is important that we have this facility of a supranational TB reference lab, which assures the quality of TB results being available to more countries. And in that regard, we are supporting Rwanda to become a supranational TB reference lab to support Francophone countries, as well as Mozambique to support the Lusophone countries. Ethiopia is being supported towards becoming a center of excellence to support their vast network of TB labs, of course, serving a very high population of over 117 million people. The areas, again, maintenance and calibration of lab equipment, which involves training of biomedical engineers, provision of toolkits, among other efforts, support to lab information systems, which ensures that we have data analysis and management of the information that is being generated from the labs, the integrated sample referral system, which ensures that we have reduced turnaround time for the results, as well as increased coverage of the lab services. And we have very good examples on the continent, Uganda being one of them, Zimbabwe being another, implementing very robust integrated sample referral systems. We have also supported the building of leadership capacity in recognition of the fact that inasmuch as we may have very technically competent lab personnel, the aspect of leadership is important in order for us to derive the full benefits of the technology and the resources that are at our disposal. In many instances, because of inadequate leadership and management capacity, we find that resources could be available. For instance, the Global Fund might provide millions of dollars, but things are not moving, perhaps attributable to inadequate leadership and management capacity. So as ECSA, we implemented the Global Laboratory Leadership Program, and this picture shows the program here in Malawi. It was also implemented in Zambia. As I draw towards the end, I would like to cite one other important initiative, which is the peer-to-peer learning. In this particular initiative, we have identified a number of countries that are strong in specific areas of lab systems. For instance, we've identified Rwanda as being strong in lab information systems, Zimbabwe for their transport referral system, South Africa for their wastewater surveillance, Uganda for their equipment maintenance, as well as external quality assurance. And we have identified groups of other countries which need support in those areas. And we've been coordinating and facilitating this peer-to-peer learning among these countries. I would like to conclude by a few takeaways. The first one being that it is important for us to recognize that a strong lab system is a key component of our pandemic preparedness and response. As we heard yesterday, the issue of financing remains very critical and really calls for us to see how we increase domestic funding. By and large, most of our lab systems have been supported by donors. And the recent developments really underscore the need for us to enhance our domestic financing. We also need to move away from siloed lab systems where you have lab systems just for malaria, lab systems just for TB, and so on. These systems need to be integrated in order for them to give us the most benefit. I've already emphasized the importance of lab leadership and governance. This extends beyond just the leadership and management capacity, but also how these labs are organized within the countries. Sometimes we see a lot of fragmentation in the lab systems within countries. And finally, it is good for us to continue to recognize that on the continent we have a lot of capacity, a lot of potential among countries which needs to be shared and cross-pollinated from one country to the other. Ladies and gentlemen, I thank you for your attention.
Thank you so much for that presentation, which has highlighted what ECSA has done across the region. We will now proceed to presentation of statements from the member countries. We can start with Malawi. Thank you.
Thank you so much, Chairperson, honorable colleagues, and all distinguished ladies and gentlemen. Good morning. Once again, it's a great honor to be part of this important gathering, and I'm also very excited that we are discussing this topic about strengthening the capacity of our diagnostics in the ECSA region and indeed beyond. Ladies and gentlemen, Your Excellencies, accurate diagnostics are fundamental to effective healthcare and also enabling timely interventions as well as improving health outcomes. In our region, health systems often face resource constraints, making the enhancement of diagnostic capacity essential for building resilience and sustainable health systems. The main challenges in the diagnostic capacity remains one, limited access, especially in the remote areas or indeed in the rural areas. In case of Malawi, at least maybe 70% of our population, they live in the rural areas, and indeed they have limited access to diagnostic services. Impact on health outcomes, limited access to timely and accurate diagnostic tools and services can delay disease identification and treatment, leading to poor health outcomes, increased morbidity, and preventable deaths. With this, ladies and gentlemen, we need huge investment in diagnostic infrastructure, laboratory infrastructure, upgrading laboratory facilities, and increasing the availability of diagnostic equipment nationwide is important to enhance the ability to detect and diagnose both communicable and non-communicable diseases. In the case of Malawi, we are in the process now of analyzing a construction of our Malawi National Cancer Center, the first one in the country. In fact, the modern brick has already finished. At the moment, we are now commissioning the equipment, and we are set to open our National Cancer Center next month in March. In terms of radiology equipment, we have installed new digital X-ray machines and ultrasound scanning machines in almost all the district hospitals, and now we have also targeted some health centers, especially in the hard-to-reach areas. Also, with the support from the Framing Fund, we have now upgraded 10 laboratories, that is in the district hospitals, to handle issues of AMR. This is a very important topic, and we also had a session on antimicrobial resistance, so we want our laboratories to be able to capture that information. We have also capacitated 3 laboratories in order to capture AMR, but in animals. As Malawi, we have already adopted the One Health approach as guided by World Health Organization. We are also in the process of installing CTI and most especially MRI machines in all our tertiary hospitals and also in select secondary hospitals. We are in the process of considering incorporating artificial intelligence into radiology equipment such as digital X-ray machines to improve access to the baseline screening for things like tuberculosis and indeed other diseases. We also have mobile vans which are fitted with the gene expert in order to increase access of services, especially pertaining to tuberculosis, especially in the rural areas. We are also in the process of building capacity and training of our health workers so that we have skilled personnel, and this needs further investment. Notable achievement under the training is that now we have trained about 18 radiotherapy technologists and 2 nuclear medicine technologists for the first time in the country. To achieve what we're looking for, ladies and gentlemen, and indeed distinguished guests, collaborative efforts are needed. International and regional collaborations, as promoted by ECSA HC, are pivotal in building diagnostic capacity. And I'm so happy with the statement from ECSA, which indeed is very keen on peer-to-peer learning so that we can build capacity and we can grow together as a region in terms of diagnostics. Also, key partnerships is very important. We are grateful to World Health Organization for their support, to International Atomic Energy Agency for their support, and indeed to African Society for Laboratory Medicine, which has been very, very instrumental in promoting the best practices as well as strengthening networks for disease surveillance and response. Strengthening supply chain is very, very important as well. In diagnostics, we need lots and lots of reagents. We have ongoing efforts to strengthen supply chains to ensure that essential diagnostic kits and materials are available at all facilities, especially in the rural areas. In conclusion, distinguished honorable members and ladies and gentlemen, agency, given the global and regional health challenges we face, we still need for continued investment in diagnostic capacity in order for us to grow our services. The call to action from Malawi is that by strengthening our diagnostic infrastructure, investing in human resource, fostering regional collaborations, and leveraging technology, we can enhance our health system's resilience and improve health outcomes for our populations. I thank you so much for listening.
Thank you so much, Malawi, Kenya.
Thank you very much, Chair. Honorable Ministers, distinguished delegates. For Kenya, we acknowledge that strengthening diagnostic capacity is crucial for improving healthcare outcomes, disease surveillance, and public health interventions. Kenya is currently making significant progress in enhancing diagnostic capacity, focusing on laboratory tests, quality assurance, emergency preparedness and response, and antimicrobial resistance surveillance. The collaboration between the Ministry of Health and implementing partners has enhanced shared learning, resource pooling, and sustainable diagnostic systems that have strengthened the country's ability to respond to emerging health threats. On laboratory quality assurance, Kenya has a well-coordinated laboratory quality management system with 7 out of 10 reference and 8 peripheral laboratories achieving international laboratory accreditation, that is ISO 15189, ensuring diagnostic practices in the country meet global standards. Kenya is also implementing the external quality assessment programs where panel testings are prepared by the reference laboratory for proficiency testing by technical staff in the peripheral laboratories to ensure valid and reliable laboratory test results for patient management. Kenya also has a Center of Excellence for equipment calibration, certification and training that support laboratories within the region. The center has actually trained about 153 biomedical engineers, and it has been supporting training and equipment calibration in Kenya and in neighboring countries like Burundi, Mozambique, Zambia, Malawi, Uganda, Lesotho, and Burkina Faso. It also provided ISO 17025-2017 audit support to Ghana and Nigeria. The center supports 163 laboratories across the country with calibrations of equipment, which include pipettes, thermometers, timers, condition chambers, centrifuges, and analytical balances, among others. On emergency preparedness and response, the efforts by the Ministry of Health in the improvement of laboratory infrastructure, fit for purpose human resources, and the cutting-edge technologies in the diagnosis of emerging and re-emerging infectious diseases and non-communicable diseases are notable areas that have seen great achievements. We have a food safety laboratory that conducts chemical residues surveillance on food and water, and the laboratory which is linked to the International Codex overseeing food safety issues and assures conformity to food standards in the country. The ministry is also committed to keep upgrading laboratory networks to expand access to molecular diagnostics, including PCR and whole genome sequencing. And as such, a national genomics and molecular laboratory with the capacity to sequence almost 250,000 genomes of pathogen has been established and is currently supporting sequencing for drug resistant for HIV, TB and malaria. And is ready also for genome sequencing of other outbreak-prone pathogens, including COVID-19, flu, mpox, Ebola virus disease, and Marburg virus disease. There are 8 lab-based sentinel sites for flu investigations and surveillance, and Kenya has also adopted the integrated specimen referral system for HIV and TB, with a possibility of expanding to cover other diseases. We note that the integration is necessary by the need to pool resources meant for sample referral and to expanded array of tests that can be conducted on an individual patient for different diagnoses and other supplemental tests for effective care and treatment. On antimicrobial surveillance, Kenya is strengthening AMR surveillance in the context of One Health, with 21 human health and 6 animal health laboratories distributed in the 15 out of the 47 counties in the country. And it is worth noting also that Kenya is among the 137 countries enrolled to the global antimicrobial surveillance system and response to the WHO annual AMR calls since 2021. Further, Kenya has been actively working to further enhance its diagnostic capacity across various healthcare sectors. A notable initiative is the Diagnostic Network Optimization, or DNO, launched in collaboration with the PEPFAR. This program aims to decentralize diagnostic services, particularly for HIV, viral load, and early infant diagnosis, by establishing regional testing facilities. These efforts have led to reduced turnaround times for test results and improved access to essential diagnostic services in previously underserved regions. The National Tuberculosis Program launched the TB Diagnostic Network Assessment, or TB-DNA, to identify gaps in the TB diagnostic landscape and improve access to timely, quality-assured TB diagnosis. This assessment aimed to inform national policies and guide resource mobilization to enhance TB diagnostic services across the country. So overall, while Kenya has made significant strides in improving its diagnostic capacity, ongoing efforts and investments are essential to address existing gaps and ensure equitable access to quality diagnostic services nationwide. Additionally, innovative approaches like the implementation of mobile diagnostic units, or MDUs, have been employed to enhance healthcare access, and especially in rural areas. Despite these advancements, challenges still persist. Notably, non-communicable disease diagnosis testing capacity still pose a considerable challenge. There is need for targeted investments to improve healthcare delivery, particularly in enhancing diagnostic capacities at primary healthcare levels to reduce congestion and the high-level facilities. And continued investment in diagnostics and fostering regional collaboration will go a long, long way in helping us to overcome these challenges and build a robust and resilient diagnostic system for future. Thank you. Back to you, Chair.
Thank you so much, Kenya. We'll proceed to Mauritius.
Thank you, Chair, for giving me this opportunity. It's now a known fact, I think differently. So my question is, when we say we are strengthening our capacity for diagnosis, do I understand that we have the capacity? First question. If we're strengthening, what is lacking? We have invested tons of money, dollars, in all our economies, putting good setup, trying to be the best, but there's something lacking. There is a loophole somewhere. My personal opinion is we have the best equipment, we try to get the best equipment, we buy, we do a lot of sacrifice in the economy, we get the best equipment, then what happens? We realize people are not trained enough, or the training that they have does not help them to read and understand what the equipments are saying. I'll give you an example in Mauritius. We bought the very best X-ray, digital X-ray. Then we realized, I'm sorry to say, I won't say we were taking for a ride, Chair, but I realized the equipment was fabulous, great job, great pictures. No one could diagnose in Mauritius. So we had to send it abroad, and each reading of the data was costing me $50. I said, there's something wrong here. So why didn't we train? I suppose when we buy equipment, one component is training. So why didn't the supplier not train us as required? This is what I call business. Okay? They want to give you the equipment, but not everything, so that, as they say, you're going to come back to them. And this becomes the business. The second thing that I also notice in Mauritius is we have tried to have the X-ray machine. I'll again take the digital one. But without the connectivity, without the whole process, which is going to be from diagnosis to the final result, to the outcome, to the doctor, and follow-up, is that there? I'm not sure. Okay? It's only one part of the equation. In Mauritius, we have tried to digitalize our laboratory by having laboratory information system. Great, I'm happy about it. Does it have connectivity to the e-health? Are we going to connect it? What is it going to bring to me? Faster result? Yes. Then who is going to read it? I have the result, but no one is going to read it. So I have to send it abroad with time difference. By the time I get it, I'm sorry, the person is somewhere else. I didn't say he died. So, what are we doing wrong? Are we doing the right thing? Are we thinking globally, or are we having piecemeal approach? Are we pulling the ears of the suppliers? You know what? Give me the whole package. I don't need piecemeal. The other thing also we have to understand is, in Mauritius, we have a new cancer center. We put up the CT scan, the cyber knife, and whatnot. You'd be surprised to know, all these equipments have been sitting in the new hospital for 1 year. They can put it on because there's a switch which says on. They put it on, then what? I don't know, because when I went to visit that with the minister, says, what do you do? I say, it's on. Then what do you do? There's something lacking somewhere. Come on. Did we buy to put it on? I can put on everywhere. But in this equipment, no one is able to use it. So what is the use of having spent, let's say, millions of dollars to have something which is of no use? Okay? Which is of no use. The other thing I would say that in Mauritius, we have tried to, we are also subject to the word I hate, neglected tropical disease, but we are subject to that. That is only able to happen if I'm able to have initiative to have mass screening for disease like cancer, diabetes, HIV, everything to do with NCD and otherwise, infectious disease. Laboratory tests are good to have. Do we have a personalized treatment plan attached to that? Or is it, you know what, you have diabetes, then what do I do? Say, I don't know, go and check. You have website. Luckily, we have Google to help us. But I understand 90% of the medical information are misleading. Or else all the doctors and all the chemists and all the diagnoses would lose their job, because we can go to Google and ask the question. The other thing is, we do believe in Mauritius that prevention is very important. And we have tried to have public health responses and policy making based on that. Example, biggest was COVID-19, influenza, dengue, measles, malaria, etc., etc., etc. When people tell me, as a layman, I'm not from medical profession, that COVID always existed, I said, oh yeah? In what form? I don't know. We should know when we are talking about diagnosis, we are talking of research and development. It should help me to have further research, local, regional. I'm sure with our ECSA and our region, I don't need to know everything. I have my brothers somewhere who can help me. It's on what I call, I used to call one call away, now I call that one WhatsApp away. I just WhatsApp someone and say, yes, I'm going to help you, Benjamin. The other thing is, although we don't want to agree, it has a large economic effect when we don't have early diagnosis. I was talking to a few of you. We found out that most of the cancer cases that we're having, we only detect at the 4th stage, where we don't have much to do except pray and help psychologically. The other thing is, we have a huge problem with diabetes in Mauritius. When we find out they have diabetes, most of the times they have to do away with their limbs some lose their eyes. So I am having an economic impact because I didn't prevent it. I'm sitting with all kind of tsunamis. So our COVID pandemic has demonstrated that we need a robust laboratory service so that we can diagnose. We have to understand COVID is here, I suppose. It's going to come, re-emerge, and it is going to be the threat. We do a lot of things to enhance our laboratory capacity, but without appropriate infrastructure. I would include infrastructure and human resources. We have the equipment. As I was listening to my friends, what about the reagents? Are we getting the best? Or are we getting the second best? Are we having sustainable funding? There's a need for comprehensive and sustainable strategy, which will extend beyond the crisis periods. To achieve this goal, we must prioritize certain areas that offers growth opportunities. There's a need to move from conventional laboratory-based diagnosis to rapid point-of-care testing, portable devices. We do have portable X-rays for some areas which are not accessible. Another area of focus should be on strengthening quality system. Quality, quality, quality. With these words, I end my statement, and thank you, Chairman, for listening to me.
Thank you so much, Mauritius. Looking at time, we are behind time. I will request the remaining speakers to ensure that we stick to the 3 minutes, looking at the other sessions which we have coming forth. Distinguished guests, allow me to invite Lesotho to give the statement. Thank you.
Thank you, Chair. Honorable Ministers, distinguished guests, distinguished participants. The Ministry of Health in Lesotho has developed a national laboratory policy for 2023 to 2027. However, a policy alone is not sufficient without actionable steps backed by data. To this end, the Ministry has conducted baseline assessments, including diagnostic network optimization, which revealed an underutilization of multiplex testing platforms and a significant 28% gap in essential diagnostics. And rather than rushing to invest in new equipment, the Ministry prioritized optimizing existing resources. This not only enhanced diagnostic coverage, but also improved the country's negotiating position with suppliers. One critical area identified was the lack of diagnostics for non-communicable diseases, particularly cancer screening. To address this, the Ministry is in the process of introducing automated cancer screening platforms aiming to improve early detection and saving lives. Expanding diagnostic capacity means little without ensuring quality. For years, Lesotho struggled to achieve international laboratory accreditation. However, 2023 marked a turning point. With the support of ECSA, Lesotho achieved a first-ever laboratory accreditation for the National Tuberculosis Reference Laboratory. Today, the country celebrates 4 accredited laboratories, with 2 more on track to apply this year. To institutionalize quality management systems, the Ministry has set an ambitious target in that by 2025, at least 50% of all laboratories in Lesotho will have functional quality management systems in place. To achieve this, the country has taken the following steps: integrating QMS activities into the national health budget, ensuring reduced donor reliance and long-term sustainability, transitioning key QMS personnel into permanent government positions to retain expertise within the system, establishing a peer mentorship program where accredited laboratories provide technical support to non-accredited ones. But there are challenges. we have the challenges of staff, shortage of staff in the laboratory department. Therefore, there is a challenge. Who do you strengthen when there is no capacity? And this may also affect accreditation of future laboratories. We also have machines which are multifunctional but are not yet fully utilized. There is also the issue of reagents. The reagents are very expensive and they're externally funded. And when we got the executive order from the United States to stop everything, it was like, but at least we still had a 6 months supply of reagents. What I'm trying to say is that the country should commit to inject more money into our health system. Thank you very much.
Thank you so much, Lesotho. We can move to Zambia.
Good morning once more. A statement on behalf of Dr. Elijah J. Mchima, MP, Minister of Health, Zambia. Honorable Minister, distinguished ladies and gentlemen, all invited guests, diagnostics are a key and fundamental component in healthcare delivery. Outbreak detection and monitoring, imaging and re-imaging health threats remains a challenge. In 2023 alone, Africa experienced 180 public health emergencies, of which 90% were infectious diseases. The past few years have seen the globe and the region grapple with a number of infectious diseases such as the COVID-19, the Marburg and Mpox, as well as rising antimicrobial resistance. Lessons were learned during the COVID-19 pandemic, and we continue to learn. However, what stands out is the importance of strengthening diagnostic capacity in our region and far beyond. Honorable Chair, Honorable Ministers, and distinguished invited guests, strengthened diagnostic capacity is essential in enabling rapid, accurate identification of causative agents, monitoring disease transmission, developing actions to prevent disease spread, and evaluating public health interventions. A number of assessments done in the African region have highlighted the inadequate diagnostic capacity and the need to invest in this area. The foundation of an effective healthcare system lies in the ability to rapidly and accurately diagnose disease, thus leading to improved health outcomes and public health security. Honorable Chair, Honorable Ministers, strengthening diagnostic capacity requires the engagement and coordination of a number of stakeholders, including the government, funding and regulatory bodies, public health agencies, their diagnostic industries, healthcare systems, professional societies, and individual clinicians. In order to strengthen diagnostic capacity, there's need to focus on financial commitments that would address the following key areas. 1, invest in infrastructure and modern equipment that would scale up laboratory networks and enhance disease detection. 2, uninterrupted provision of diagnostic reagents and consumables. 3, workforce development and capacity building through continuous training and knowledge exchange. And lastly, cross-border collaboration and data sharing to enhance preparedness and response to outbreaks. In conclusion, Prioritizing diagnostics can bridge existing gaps, reduce burden of disease, and ultimately save lives. Let me end by emphasizing the importance of building partnerships between governments, private sector, and global health organizations. Zikomo Kwambiri.
Thank you so much. Zimbabwe.
Thank you, Chair, Honorable Ministers, and all protocol observed. I will read the statement by the Minister of Health and Child Care, Honorable Dr. Douglas Mombeshora. Access to accurate and reliable diagnostic services is a critical component of a well-functioning healthcare system. In Zimbabwe, the diagnostic landscape faces numerous challenges, including inadequate infrastructure, limited access to specialized diagnostic equipment, and shortage of skilled personnel. In Zimbabwe, the healthcare system has faced significant challenges in recent years, including a shortage of medical supplies, equipment, and personnel. The COVID-19 pandemic further highlighted the need for a robust diagnostic system. The pandemic put a strain on the country's already limited diagnostic resources, underscoring the importance of strengthening diagnostic capacity to respond to current and future health needs. What is happening in Zimbabwe? There is ongoing installation of digital X-ray machines in district and mission hospitals, point-of-care diagnostics distribution to primary care level, MRI available at all tertiary institutions, CT and ultrasound scans available at provincial and central level. TB X-ray tracks have brought ease of doing business in Zimbabwe, and also the mobile clinics for cancer screening. However, the need for strengthened diagnostics is real. Strengthening diagnostics is essential for improving health outcomes and enhancing disease surveillance. Our call for action is the same like other countries, Mr. Chair. We call on the governments to prioritize investments in diagnostic infrastructure, equipment, and personnel, diagnostic access and equity. Relevant diagnostics should be available throughout the entire system of clinical services and should be standardized. This can be achieved through decentralization of testing technologies, deployment of point-of-care machines in hard-to-reach areas, designing and implementing fluid integrated sample transportation system, improve the diagnostic capacity. Reference laboratories should be capacitated by technologies that can identify imaging and re-imaging infections. Human resources to be capacitated in new methods such as sequencing and big data analysis, as in bioinformatics. Quality management systems. There should be enrollment of laboratories into reputable quality management systems such as ISO 15189 for reference laboratories, and higher tier laboratories while enrolling lower level into national certification programs. Laboratory information management systems should be in place, and this enhances increased turnaround time of results and tracking of samples. Data can also be summarized easily and put into dashboards for different levels of the management. There is need for commensurate budget for fiscals to support diagnostics. Therefore, there is need for advocates for adequate budget from governments and donor communities. Fluid supply chain management systems, which should be based on evidence and also focusing quantification and ensuring minimization of stockouts. Investment in diagnostic networks. There is need to develop diagnostic centers of excellence for prevalent diseases for ease of referral of the samples. In conclusion, Mr. Chair, strengthening diagnostics in the ECSA region is critical for improving health outcomes, enhancing disease surveillance, supporting pandemic preparedness and promoting economic growth. We therefore should work together to address the challenges facing the region's diagnostic landscape and ensure that all citizens have access to accurate and reliable diagnostic services. I thank you.
Thank you so much, Zimbabwe. Tanzania.
Chairperson, honorable ministers, heads of delegations, esteemed guests and colleagues, good morning, Jambo and Muli Bwaji. The United Republic of Tanzania commenced the 74th ECSA Health Ministers Conference for prioritizing diagnostic services within the region. These services are crucial for identifying causative agents, detecting pathogens during our outbreaks, and monitoring disease trends and testing for antimicrobial resistance, which we had a lot yesterday within our communities. To ensure the quality and accessibility of these services, Tanzania has made a significant strides, including the country has accredited 85 medical labs to international ISO standards. We have established a regional center of excellency for biosafety and biosecurity training, and the development of in-country capacity to certify biosafety cabinets. We have attached a meaning to the endeavor by investing in quality management system, mentorship, assessment, and the collaboration of accessory equipment. These diagnostic services capacities meet international standard and can be leveraged and shared among all the 9 member states of ECSA. We invite you to benefit from these services. To further enhance the quality of lab services in Tanzania, the country has developed in-country capacity to produce and distribute proficient testing samples. 3 national level laboratories have been designated to produce proficiency testing samples for various diseases, including tuberculosis, HIV, malaria, the blood grouping serology, bacteriology, hematology, and clinical chemistry. These labs can prepare and distribute proficiency testing panels both within the country and beyond our borders. Further, we have made a substantial improvement in our accessibility of medical imaging services at various levels of our healthcare system. This includes availability of CT scan in all the 27 regions in the country. We have put magnetic MRIs in the zonal hospitals and other regional hospitals, and we have put a brand new PET scan at our National Cancer Institute in Dar es Salaam. This significantly has reduced our referring of patients abroad, saving millions of forex currency, which are hardly earned. Honorable Chairperson, the servicing and maintenance of diagnostic devices are vital for ensuring the continuity of medical diagnostic services. In Tanzania, we have established zonal maintenance centers with the capacity to perform maintenance on laboratory and radiological devices and equipment, ensuring these services remain operational 24/7, 365 days a year. Chairperson, in conclusion, I urge all member states to share and collaborate on local diagnostic services for sustainability of these services across the region. Services procured outside the region tend to come at a higher cost. I was listening attentively to presentation from Mauritius. I think this is where we need South-to-South cooperation. Because what we have done in Tanzania, in parallel, actually now we don't purchase, we go for placement. For placement, they have to train your people before acquiring the equipment. Because what if you buy the equipment this year, then 3 years from today, it's outdated. You'll buy a new one. But if it's placement, they'll place you with the latest machine. What we would encourage ECSA, please let's map the 9 member states of ECSA. What services are where, what training or human capacity are where, so that we can exchange within ourselves. In this regard, the United Republic of Tanzania invite other members to join in sharing these services and enhancing regional collaboration. Health is an investment, not just a cost. This conveys the idea that investing in health yields long-term benefits rather than being merely an expense. With your permission, Mr. Chairman, just one line to comment again on Mauritius about diabetes. If it's type 2 diabetes, Honorable PS, it's just lifestyle. Personally, I've moved patients from using pills just by changing their lifestyle. It's not caused by any pathogen. We'll share this during the break. Chairperson, thank you for your attention. Merci beaucoup, asante sana. And in Chichewa, Salani Bwedeno and Pendenai. Thank you very much.
Thank you so much, Tanzania. Honorable Ministers, distinguished guests, allow me to invite Action NCD International just to give a statement, then we'll proceed to the plenary. Thank you.
Thank you, Honorable Chair and Your Excellencies. I just want to make a comment on non-communicable disease diagnostic. I'll just tell you a story. I went to a primary health care clinic in Africa. I told the nurse to actually do her consultation so I can take a picture. After a while, she's still yapping with the patient. And I said, why don't you pick up your sphygmomanometer and measure the blood pressure so I can then take the picture. She looked at me and smiled and said, yeah, about that. I am waiting for Thursday, and this was Monday. I'm waiting for Thursday for the sphygmomanometer from the other clinic to be available, and then they will bring it to me, and I will then follow up with my patients. And I said, how many in your coverage area? About 4,000 population. And I turned around to the sister in charge. I said, really? At this time and age, a fully qualified nurse has to wait for 4 days before he can get a working sphygmomanometer that costs about $20 in order to follow up on the patients. In the light of the declaration of NCD as an emergency yesterday, I think the call and the ask from non-communicable diseases is quite simple. If we can get to the basics right. We don't need an expensive laboratory. Most of the devices are now portable. You can get a sphygmomanometer. If you're still using mercury meters, that's no longer recommended. It's bad for the environment as well. The digital one will cost $20. The glucometers, most of the clinics is not working. There's a bit of a recurring cost. It will cost you $20 if you do it. Glycosylated hemoglobin meters, we test for HbA1c, is about $200. And a working ECG machine is going to cost you about $200 as well. For $500, you can get the primary health care clinic fully equipped for non-communicable disease. And if you do a mass purchase of this, it could probably cut it down to half. And these should be made available to primary health care clinic. So while we discuss diagnostics, and it's great the progress in communicable disease, we would like to ask, in the light of yesterday's declaration, that this simple, basic medical diagnostic be made available to primary health care clinics, so our fully qualified nurses and doctors could actually be equipped to tackle the crisis and the emergency that we declared yesterday. I thank you, Chair.
Thank you so much. We'll proceed to our plenary session. We have had different statements on the same topic and also a presentation. So I would like to invite anyone with a comment or a question. I'll just invite just 3 hands which will be first to come up, looking at time. So do we have any questions or comments? I can see 1 hand. Thank you so much. We only have 1 hand. I think we can receive that comment and then we can proceed. Thank you.
Thank you very much, Mr. Chairman, and all protocols observed. I am very happy to speak after our colleague from Tanzania's presentation on behalf of the nation of Tanzania. I'm recalling Health Ministers Conferences from many years ago, at which we said we are not leveraging ourselves as a region in terms of dealing with suppliers. There are reasons which can best be described as petty, whereby we allow individual groupings within countries, individual groupings within the region to negotiate with suppliers and get a very poor price. You remember when we were discussing the supply of drugs at one time, we actually thought as ECSA, we could negotiate with suppliers of commonly used drugs so that we lower the price because of bulk buying. We never implemented that. We're doing the same thing with diagnostics. We are each individually negotiating with suppliers of X-ray machines, suppliers of laboratory equipment, and we're all paying premium prices for that equipment. But not only are we disadvantaging ourselves in terms of costs, we are creating a position where even within a country, you have one hospital using one equipment, another hospital using another equipment, and we have reagents which are running out of, they are used by date because of numbers, whereas if we shared them across the country or even across the region, we would not run out of reagents because they'll be common reagents. I was very touched by our delegation leader from Mauritius talking about expensive modern digital X-ray machines. In our country, we just bought one of those as well. And there's something that has been raised, which is the issue of, do we buy the most modern equipment? Of course we want to buy the most modern equipment. But can we deploy it? We're failing to deploy some of the most modern equipment and using all of its features. Just like you and I have a cell phone in our pocket where we're using 50% of its capacity because we don't know how to use the other 50%. But with the equipment that we are investing to put in our institutions and our healthcare service delivery system, we really should be able to insist on appropriate training at the point of delivery. And I'm not just talking about training of the users, in other words, the laboratory diagnostics staff or the X-ray radiographers staff. I'm also talking about the clinicians. It's no good putting in onto an electronics platform the results that come out of the diagnostic service if I don't know how to access them and I'm the one looking after the patient. It's not enough for us to buy equipment that produces results that are deployed onto a platform when the users in other words, the clinical service providers, don't know how to get onto that platform. When the system in the ministry does not have a person who maintains that platform so that it's accessible to all users across the nation, particularly those in the district hospital service. I find that we've all talked about telemedicine, and one of its greatest value is when somebody's at a district hospital, they do a test, and they don't know what to do next. And they will seek my service as a consultant at a tertiary or quaternary level. And then I say, can you send me the X-ray? The X-ray is digital, is accessible to that chap at the site, but he doesn't know how to transmit it to me. Or I don't know how to access what is transmitted to me. And this is happening across the entire region. So let's get training at all levels as part of the service agreement with the suppliers. And we should really insist on a protocol. When we started the male circumcision program as part of the PEPFAR-funded project, one of the things is we said there should be standard ways delivered across the entire region. And we achieved it. There's no reason why we can't do the same for all the other service systems that we are deploying in our countries. If we use ECSA for what it is good at, which is providing protocols, creating standard operating procedures for commonly carried out activities, we should be able to do this and save our countries from individually paying the price that is duplicated across nations. Thank you.
Thank you so much for that comment. You have brought out valuable points. We can proceed to our next session. We can come to the close to the first session for 9 to 10 hours. Looking at time, we are a little behind time. The next session, which is session 11, is on local manufacturing of medicines and medical supplies, opportunities and challenges. Honorable Ministers, distinguished guests, allow me to invite the Honorable Cabinet Secretary of Health in Kenya to come and give his statement, sir. Can clap for him, please.
Yeah, so I'm representing the Cabinet Secretary, Honorable Dr. Deborah Baraza. My name is Dr. Mleshe from the Ministry of Health, Kenya. So the chairperson of ECSA Ministers Conference, Honorable Ministers from the ECSA member states, the chairperson of the Advisory Committee, Director General ECSA, distinguished delegates, development partners and stakeholders, ladies and gentlemen, allow me to present this statement on behalf of the Cabinet Secretary on building capacity for local manufacturing of pharmaceuticals in Africa, the opportunities and challenges. So as we gather here today, it is essential to focus on a critical pathway to achieving health security and economic sustainability through building capacity for local manufacturing for pharmaceuticals. His Excellency, the President of Kenya, is the African Union champion for local manufacturing, and he spearheads the activities and aspirations of realizing that agenda in the health sector. The health sector has excellent potential to significantly contribute to industrialization through intensive investments in local manufacturing of health products and technologies. By focusing on this area, we can achieve medical product security, contribute to the overall economic development of our country through job creation, improve access and affordability, and ensure the sustainable implementation of universal health coverage. Furthermore, advancing our local pharmaceutical manufacturing capacity advances the continent's competitiveness regionally and globally through the advances in manufacturing that will be brought about by investment in these complex industries. Increase foreign exchange savings through reduced imports, improve the balance of trade for African countries, and enhance our position as regional economic partners. The African pharmaceutical industry is exhibiting rapid growth, worth approximately US $28.56 billion in 2017, up from about 5.5 billion a decade earlier. That is according to the pharmaceutical market research that was done in 2019. And therefore, the market is projected to expand to between 56 billion and 70 billion by 2030. This growth underlines the need for strategic positioning of Africa's local pharmaceutical industry to capitalize on this opportunity. Currently, Kenya imports of about 7% of the health products and technologies that it consumes, with significant imports from India, about 37%, from Europe, about 20%, from China, 9%, the US, 6%, and South Africa, about 4%. Alarmingly, this means that only about 28% of the health products we consume are locally produced. However, in 2021, Kenya exported approximately 138 million US dollars worth of health products, primarily to neighboring countries, reflecting the potential for overseas sales and creating further opportunities for local manufacturers. Kenya has made significant strides in local production, as evidenced by the 5,744 jobs created in 2017 in manufacturing essential pharmaceutical products and preparations. Additionally, the country takes pride in having 2 local manufacturers of antiretroviral drugs that meet WHO good manufacturing practice standards. These facilities possess the potential for increased capacity utilization, particularly as we move towards His Excellency the President's commitment to achieving at least 50% local sourcing of medicines listed in the Kenya Essential Medicines List by 2026. Moreover, the recent COVID-19 pandemic has catalyzed an increase in local manufacturing, with numerous countries establishing small to large-scale enterprises that produce personal protective equipment. Even though they rely on imported raw materials, this shift indicates that a growing awareness of the importance of local production and the opportunities it presents for economic resilience. Despite the positive outlook, several challenges impede the optimization of the local pharmaceutical manufacturing in Kenya. Addressing these obstacles is paramount to achieving our local manufacturing goals. I'll highlight a few of them. One being lack of locally produced raw materials. One of the biggest hurdles is the unavailability of raw materials. Active pharmaceutical ingredients or APIs and excipients produced within the country. This shortage necessitates high costs for importing these essential supplies, hindering competitive pricing for local products. The other challenge is high costs of inputs. The costs of essential inputs such as power, water, packaging materials, and taxes on imported packaging materials significantly affect production. These high costs decrease competitiveness and deter new investments in local manufacturing. The other challenge is inadequate investment in research and development. Investment in R&D is essential for innovation in product development. However, insufficient funding is currently directed towards developing new products and formulations tailored to local needs. Absence of clinical research organizations, so the lack of established clinical research bodies capable of conducting bioequivalence studies forces local manufacturers to outsource these tasks. This increases the operational costs and delays time to market for locally developed pharmaceuticals. The other challenge is lack of favorable long-term financing. Startups and established manufacturers often find it challenging to secure long-term financing to invest in new production facilities, limiting growth potential within the sector. Unfair competition, we realize that foreign companies frequently benefit from favorable policies in their home countries, allowing them to offer lower prices than local manufacturers. This disparity and uneven playing field that stifles the growth of local industries. Then public perception of local products. The general perception among consumers that locally produced products are lower quality compared to imports poses a significant barrier. And therefore, changing this mindset is essential to promote the uptake of locally manufactured health products. We also have stringent requirements in achieving good manufacturing practices and pre-qualification status, such as WHO pre-qualification, resulting in a lack of global competitiveness. Then lack of clear technology transfer. Lack of clear technology transfer rules, or better yet, a culture of technology co-creation to benefit local economy and build sustainable capacity in the country and the region where Kenya has lost a lot of foreign exchange due to restrictive technology transfer. So what are some of the solutions required to spur local manufacturing? One is increased tariff lines for imported health products and technologies as outlined in the ESC CET 2017 to adequately cater to these closely linked products, reduce ambiguities and avoid hindrances to market access, setting aside infrastructure like land as pharmaceutical villages to attract local and foreign investors to build plants to manufacture local health products and technologies locally, strengthening research, development, and innovation by increasing financing for clinical trials through research institutions, work with power producers to substantially reduce costs for our local manufacturers and encourage use of green energy. And last but not least is strengthen the local regulatory agency for health products and technologies to ensure it achieves maturity level 3 or above. So in conclusion, building the capacity for local manufacturing of pharmaceuticals in Africa presents abundant opportunities for economic growth, job creation, and enhanced health outcomes. So we can create a sustainable and competitive pharmaceutical industry by addressing the pressing challenges that hinder local manufacturing. Honorable Ministers, distinguished delegates, ladies and gentlemen, that brings me to the end of my statement, and thank you very much.
Thank you so much, Kenya. We can proceed to have a presentation on the experience of the Kenyan-based pharmaceutical firm. Okay, I can see that is getting ready online. Please, when you are ready, proceed.
Good morning.
Good morning.
Can you hear me? Good morning.
Good morning.
Just testing my mic. Okay. So my name is Dr. Bina Mahida. I'm the Regulatory Affairs Manager as well as the company pharmacist for Cosmos Limited, which is one of the leading local manufacturers based in Nairobi, Kenya. I'll just quickly take you through the company's growth right from when it was established. So that is Dr. Prakash Patel, our founder, who was a pharmacist by profession. He moved to Kenya in 1959 to work as a pharmacist. He started working as a wholesale business dealer. In 1984, we started the manufacturing plant, and over the years, we have tried to progress slowly, introducing different GMP blocks. For
Sorry, excuse me. Is it possible to put it in the slideshow?
Yes.
Please.
Is that fine now?
Not yet.
Okay. Sorry. I can just do it again. Is that fine?
No. Looking at time, I feel you can, I suggest that you just go ahead with the same way showing.
Thank you.
Yeah, thank you.
Okay, so I'll just continue. So we got, in 2008, we started our PICS certification program. And since then, we have had 2 certifications from PICS, the latest being in 2023. These are our product ranges. We have many ranges, over 300 products registered in Kenya and trying to register outside as well. ARV is also one of our products. We have antibiotics, cardiology products. We also have the vet products in the range. We are active in more than 12 countries on the continent. Some of them we are actively registering our products, and for some we have just commenced the product registrations. This is our production capacity, and our strong area is tableting, that is a solid dosage forms. Liquids, ointments, and dry powder, we have the capacity. However, because of market demand, we really don't use our capacity to the full. Now from here, I'll just discuss a little bit more. If we look at our future plans as a company, we don't want to just be in Kenya. In addition to the 12 countries that we are trying, we really want our products to be available all over the continent. And in that case, we have also tried registering our products in many more countries, and especially outside the EAC region, because initially EAC was our main focus. We are also trying to look at formulation and development for newer molecules. And most of the time, we're also trying to look at products where initially on the continent, we only had the innovator products, which are usually very expensive and therefore not affordable for many patients. And we're trying to see if we can at least be the first generics, or at least among the first generics, to introduce these products so that they're affordable for the patients. We are also looking at expanding our businesses, and that is now if we manage to register more products outside, it can be a plan for business expansion. And in the future, we're also trying to see if we can expand our businesses in terms of the veterinary area. So we will have a different site for vet. Some of the challenges we have faced as a local manufacturing in Kenya and in the region, and I think some of the items have also been discussed by the previous speaker. One is inadequate qualified as well as skilled task force. We are really working with the academia, we are working with even PPB to see how we can manage to get qualified people from different areas. Because what is happening currently, a lot of the areas we have to look for expertise outside the country. And we feel that if Kenya is able to manage this locally, it will also save us a lot of cost, and it will also help us create more employment for our own people. So we have research and development, utilities such as the HVACs, qualifications. Many of the times we are getting people from India to do this work. If they were available locally, it would be a really good chance for us. In terms of product registrations, we currently face delays in the sense it takes a lot of time, sometimes even up to 3 years for us to register a product. And that is where the request to all regulators is if these lead times can be brought down so that at least we're able to register our products faster and introduce them quickly into the market. Sometimes some of these products are the first generics, and therefore I feel it is very important if we introduce them to the region faster. We don't have much incentives for the local manufacturers, and that has also been indicated by the previous speaker. We are looking at how the government can protect the local manufacturers, either giving us benefits in terms of taxes, giving us preferential procurement, and so that we are able to increase our capacity, we are able to meet the demand. And local manufacturers don't really have a challenge in terms of investing, but we can only invest if we know that there is demand for these items, and also there is some kind of benefit that we are getting for these products. Fourth is increased competition from imported products. This is also a challenge we're facing because most of these imported products are cheaper, and the reason is that in their own respective countries they have a lot of benefits being local manufacturers, which we are not having. So when they come to the market, they're very cheap. And we've also seen instances where we have had to stop manufacturing a lot of our products because we cannot really compete the prices which are in the market. And I also feel for regulators, there is usually a very high chances of having substandard and falsified medicines in the market because of these imported products. And the request is that if there is a way we can even at least try reducing importation of these products as long as they're manufactured locally, and if we are able to meet the demand. As I have seen, there are many African countries who have managed to do that. Unfavorable tax regimes, also indicated earlier. We also have very high cost of utilities, which in turn increase the production cost. And considering that pharmaceutical products are exempt in terms of VAT, we are also having some proposals to the government that instead of exempt, if they can actually be charged like around 4% VAT, so that at least it enables us claim our production cost, bringing the production cost down, and this will be reflected in the final costing of the product. We also have new regulations which keep coming up, and a lot of them are very costly. For example, we have a new requirement of bioequivalence, which we have been trying to request our regulator for the legacy products, considering they have been in the market for a very long time, if they can at least waive bioequivalence for us, and we consider bioequivalence for now the new products for which information is very limited. So this is what we were asking the government, if it is something that can be done, and this will also help us boost our local manufacturing. One is our equipment, and as also mentioned, that all the manufacturers try upgrade the GMP standards, and for that some of the equipments are usually brought in. These equipments are not really exempted from VAT. We are charged a 16% VAT. So when these equipments come here, they are already costly, and this cost will then be put into the final cost of the product. We also wanted to request if a VAT of 4% can be introduced into the locally manufactured pharmaceutical products, which are currently on exempt, enabling us to at least claim our production costs. This way, at least the final cost of the products that are introduced into the market will be lower, making us competitive when we compare with the imported products. We would also request if regulatory pathways in the region and on the continent can be somehow streamlined. Locally manufactured products should be considered for fast track. And fast track because we have also seen where it is written fast track, but really what happens on the ground is not really fast track, and it still takes a lot of time. And what happens in this case, other manufacturers from outside the continent come and introduce their products when they could be locally manufactured and introduced. We would also request if regional joint registrations can be streamlined. We have even in the ESC, but currently we're also facing a lot of challenges. And therefore we would request if these regional registrations can be streamlined. It will really save us a lot of time, considering we will be going through one country and be able to register a product in more than one country. Incentives local manufacturers, we would request for preferential procurement, not only in Kenya, but in the region as a whole, so that any product that is manufactured in the East African region is considered locally manufactured in the entire region. We would also request our regulator to charge 12% verification fees on imported products, as long as those products are manufactured in Kenya by 2 or more manufacturers and they're able to meet the demand. And in this way, at least even the imported medicines will become competitive in the market, if you look at local manufacturing products as well. And our last ask is that if more than 3 companies are manufacturing a particular product, and they're able to cover the demand of the market, then really the government should stop importation of these products. It is very easy for the regulators to manage a product that is locally manufactured because the company is here, we are here. In the event of any issues, we are available to answer the questions. So these are some of our asks to the government. The only thing I would request is that we are trying to get local manufacturing on the continent, and we would be really happy if we are involved in all these discussions. We would really like a smooth and seamless coordination with the government, with the regions, with the continent, and we are here to support as much as we can to make sure that local manufacturing on the continent is a success. Thank you.
Thank you so much, Bina, for that presentation. Honorable Ministers, distinguished guests, we'll proceed to the statement from Member States. I request that we stick to 3 minutes when giving our statements. As we all know, it's extremely difficult, almost impossible, to inform the Honorable Minister that it's time up. So I request that we ensure that we stick to the 3 minutes. We can start the statements. I can see Uganda. Thank you so much.
Thank you so much, Chairperson. And I want to thank the representative for the Cabinet Secretary of the Health of the Republic of Kenya for the insight observations on the state of medicines and the diagnostic manufacturing and the steps so far taken. I do associate with his presentation. Secondly, as Uganda, we have also moved ahead that we have a political will when it comes to local manufacturing, and we have already had some private partners. I think you heard during COVID-19 when we had our own medicine known as Covidex. And we have put into place incentives and in the environment that is conducive for our local manufacturers to be on board. It's one of our policies, and as the Kenyan representative said, COVID-19 pandemic taught us valuable lessons that reducing our dependence on imports will enhance our supply chain resilience and ensure timely access to essential healthcare solutions during that we are not able only to depend on the external and chain. Our public health emergency systems, of course, can only be strengthened when we are manufacturing our own medicine. In addition, investing in local production creates opportunities for our people through job creation, as all of us know, stimulates our economic growth and allows us to develop medical products that are tailored to regional health challenges. In addition, it provides for an opportunity of leverage existing within resources such as the biodiversity. And here in Uganda, we have emphasized so much in promotion of the scientists that we have a full cabinet in charge of innovation and technology, and we are moving ahead to ensure that local manufacturing is one of our priorities. However, there are still major challenges that persist. For example, regulatory barriers, high production costs, limited technical expertise, and access to capital hinder growth. The reliance on imported raw materials alluded to by the Kenyan government and the increased costs making local productions less competitive. Ensuring quality assurance and regional market access also remains a priority for us as a country and within the region. Inconsistency in regulatory standards across our borders also is another thing that we should address. Finally, I think we require harmonized regulatory frameworks that can bring all of us aboard, and we must have together a governance through regional cooperation that creates an enabling environment by providing incentives, pooling demand, finances, facilitation, and transfer of knowledge. And I want to end on saying that over-reliance on donor funding, over-reliance and dependence on external technology, it's high time that we as countries, member states, we work together to ensure that the technology we have shared and transferred benefits our population. I thank you.
Thank you so much, Uganda. Lesotho.
Thank you, Chair. Greetings from the Mountain Kingdom, honorable members, all protocol observed. I will be delivering the statement on behalf of the Honorable Minister of Health, Lesotho. Lesotho had a local pharmaceutical manufacturer, mainly manufacturing tuberculosis medicines. However, it stopped operations in 2007. The factors that led to its closure included limited funding to sustain production at the expected standards of good manufacturing practices, GMP, as prescribed by WHO. Additionally, due to lack of legislative frameworks in the country to support GMP compliance. As a baseline, Lesotho has made significant progress in laying the ground and advancing local manufacture of medicines and medical supplies. This includes, among others, legislative progress through enactment of the Medicines and Medical Device Control Authority Act of 2023 that is aligned with the EU model law on health products, marking a critical step towards regulatory development. 2, regulatory framework. The establishment of the Lesotho Medicines Regulatory Authority is in progress, with board members being appointed, a chief executive officer, selection process initiated, and staff recruitment being planned. 3, operational planning. A comprehensive constant 5-year plan of the Lesotho Medicines Regulatory Authority has been developed and included in the national budget for the year 2025-2026. So looking at the opportunities, economic opportunities, leveraging on the country's established cannabis sector, Lesotho is positioned to produce high-quality active pharmaceutical ingredients for local use and export. Quality and safety, enhanced control over production standards is expected to reduce substandard and falsified medicines, supporting efforts to curb antimicrobial resistance. 3, cost reduction. Local production is expected to lower costs by eliminating transportation, tariffs, import-related expenses, improving affordability and access to essential medical products. So in conclusion, Lesotho remains committed to strengthening local manufacturing initiatives. I thank you.
Thank you so much, Lesotho. We can move to Mauritius. Thank you.
Thank you, Chair. This is an interesting topic to all of us, local manufacturing. Why not regional manufacturing? Okay, all of us can pool together our resources, and we can work together so that we could have a regional manufacturing where we'll have economies of scale and we'll cut down the cost. I know one thing from experience in Mauritius, we have all the licensing compliance framework in place, but it's not picking up. We have local manufacturers, they think 20 times before setting up any manufacturing. Can they compete with others? I don't know. When I see what we do in Mauritius, when we are importing our medicines and medical supplies from countries like Bangladesh, India, etc., our costs have decreased by 50%. But have we compromised on quality? No, a big no. Quality is there. They have made sure that the quality standard has been maintained. So why can't we do? Perhaps some of us can do a few things locally, but we should go regional. Chair, this is what I feel. We have to know also that perhaps we could have some franchise, some licensing done, or the quality standard put up by everybody. Is it applicable to us? Is it too stringent? Is it really a hurdle or not? Why are we not able to achieve that standard? We have all the resources in the world we can think of. We have the best manpower we can think of. We can import everything which is there. Over and above, Chair, we have all kind of commitment, government commitment, total commitment. So why are we not succeeding? Everything seems to be in place, but there's something lacking. What is that? Perhaps unity among ourselves. We should be together. We should be able to talk to each other. This is a good forum. Let's think what I can do and what you can do, and we help each other. I don't think we should go into the whole array of products and medicinal supplies, all of us. Why? Let's concentrate, let's focus, let's be professional, and we agree. You know what? You do A, I do B, and we give it to C. So thank you, Chair, for giving me time. I'm not over time. Thank you.
Thank you so much, Mauritius. Zambia.
I'll ride on all the protocols observed. Honorable ministers and distinguished invited guests, first and foremost, I would like to express my gratitude on behalf of Dr. Elijah J. Mchima, MP, Minister of Health, Zambia. I'll read on his behalf. He would like to express his gratitude to the organizers for this meeting, for considering this important topic to be part of this wonderful meeting. Honorable ministers and distinguished guests, in the wake of Zambia's ambitious economic transformation The pharmaceutical sector has been identified as a critical pillar for industrial development and public health enhancement. Zambia's pharmaceutical industry has made significant strides in recent years, driven by the government's commitment to promoting local manufacturing and reducing dependency on imported medicines. You may wish to know that over 90% of Zambia's medicines are imported. Honorable Ministers and distinguished invited guests, Zambia has made the following successes. The government has developed a sector development strategy for local pharmaceutical manufacturing aimed at accelerating the growth of pharmaceutical industry in the country. 5 existing pharmaceutical manufacturing companies are being assessed for good manufacturing practices to improve product quality and safety. And thirdly, the government is investing in education and training programs such as the upskilling and capacity building for 10 industrial pharmacists at the University of Zambia. Honorable Ministers and distinguished invited guests, opportunities for local pharmaceutical manufacturing exist in Zambia as follows. 1, growing demand. Zambia's increasing population and disease burden creates a rising demand for locally produced human and veterinary medicines. 2, regional market potential. Expanding production could cater to neighboring countries, leveraging on the SADC's initiative like the Regional Animal Health Strategy. And thirdly, public-private partnerships. Collaboration between government, private companies, and NGOs can accelerate infrastructure development and research. Honorable Ministers and distinguished invited guests, there are a lot of challenges in the local pharmaceutical manufacturing as follows. 1, over-reliance on imported medicines. This has caused longer procurement and delivery times, delays in availability and access to essential medicines, and externalized revenue. Secondly, limited infrastructure and technology. Inadequate manufacturing facilities, unreliable power, and inadequate cold chain storage capabilities hamper efficient manufacturing. Thirdly, resource constraints. Access to capital for investment in research, development, and infrastructure expansion is a barrier hindering competitiveness. And lastly, skilled workforce shortage. A lack of qualified personnel in these areas like industrial pharmacy, pharmaceutical science, and regulatory affairs restrict industry growth. In conclusion, Zambia has a strong basis for developing its pharmaceutical industry, given the highest level of political commitment, an established small industrial base, and a strong regulatory authority and latent export opportunities. Thanks for its land-linked status, it's able to link itself to neighboring member states, which offers opportunities for growth. I thank you all.
Thank you so much. We can move now to the plenary session. I will request for questions, comments. I can see one hand. Do we have 2, 3? Thank you so much. We can start with 1, 2, then 3.
Thank you, Your Excellencies, all protocols observed. My names are Karim Wanga from IGAD, is the Intergovernmental Authority on Development. We are working very closely with ECSA on this agenda of local manufacturing of health products and technologies, including vaccines. We all agree that over-reliance on external supply undermines response to health emergencies. So we are working to address three critical areas. One is good manufacturing practices, strengthening good manufacturing practices for local manufacturers. Two is regulatory system strengthening for medicines regulation in collaboration with Africa Medicines Agency and Africa CDC. The third one is technology transfer with international agencies like World Intellectual Property Organization. And the other one is market shaping. We have all talked about the issue of export markets. And I think it's important to note that not all countries can be hubs for manufacturing of pharmaceuticals. We really have to align our capacities and see how we can trade with each other. And there are two instruments that exist at Africa Union level. The first one is Africa Pool Procurement Mechanism, APPM, and the second one is Africa Continental Free Trade Area. So these are instruments we can leverage to see how we can enhance the flow of these finished products across the countries within our region. The company that presented earlier, that's Cosmos, this company had capacity or has capacity to produce anti-TB medicines. But they stopped producing these medicines at one point because of the issue of market. Local governments were not able to sustain their market. So we need to see how as governments we can guarantee markets for local manufacturers, for sustainability. The issue of clinical trials, I think, is very important, especially R&D for us to develop our own new technologies and drug substances to support manufacturing of finished products. And lastly, I think local manufacturers cannot succeed without government support. Thank you.
Thank you so much. Next.
Thank you, Chair. My name is Felix Maonera. I'm with the Organization of the African, Caribbean, and Pacific States in Geneva. Just to note that all the members of ECSA are also members of the OACPS. Just to pick up on something that Mauritia said and that our friend from IGAD also said. And this is about expanding the definition of local production or local manufacturing to regional manufacturing. And our colleague from IGAD referred to two instruments at the AU level that allow for that. I'm just going to add another instrument, which is at the WTO level, or where all the member states in here participate. This is something as developing countries we negotiated since 2001. We got it in 2016. And it does expand the definition of local manufacturing to regional manufacturing. This is because the pharmaceutical companies were very honest with us and said, there is no way you can expect to receive technology from us because, frankly, your markets are too small, your populations are too small, and we will not be making any money from that. So just to find out from the member states in here how practical it is, or whether some of them are considering the regional manufacturing capacity angle that has been brought up. Thank you, Chair.
Thank you so much. I saw the third hand.
Yeah. Okay, my name is Peter. I work with the World Bank. I just want to mention three things building on what my colleagues have just talked about. The first one is that we currently actually support both IGAD and ECSA in supporting countries to develop capacity for local manufacturing, and specifically Kenya for vaccine manufacturing, and likewise Ethiopia. So that is one. Two, I think the most important thing which we need to consider is really the issue of regulation. Most countries, when we talk about regulation, when you look at their authorities, the authorities operate at a very low level. As we speak now, it's only Tanzania which is ML3, but it is not vaccine manufacturing. Recently, Rwanda also became ML3. Now, if you want really strengthen to build capacity for local manufacturing, you can't build it without regulation. Medicines are among the most regulated commodities in the world. You will not be able to export your commodities outside your country because you don't have the assurance to be able to demonstrate that whatever you export has been adequately regulated. So one of the things I really want to propose for the ministers to consider is the issue of strengthening regulatory capacity in these countries. The last comment which I'll make, building on my colleague, is that of market shaping. We have done work looking at countries and talked to manufacturers to find out if they are able to sell the drugs they produce to the ministries of health. And the answer is not really very good. In most instances, they are not able to sell for a variety of reasons. One is cost, but it's also true that when they sell to the government, it takes quite a long time for them to be paid. So I think, again, the ministers may need to look at some of the impediments which are affecting the ability of the local manufacturers in selling to the ministers of health. And finally, as part of market shaping, we all cannot produce the same commodities. I think this is where the ministers need to sit together and work with the local manufacturers, because this is where the support is needed, to be able to identify which are the core commodities that you really feel are important to be locally manufactured, get incentives in place, but also agree with manufacturers that can then support this across the countries without necessarily having people producing the same things and then competing and not being able to compete, eventually collapse. So those are the 3 comments I wanted to make. Thank you so much.
Thank you so much for those comments. I guess I couldn't get a specific question. Honorable Ministers, distinguished, we have another hand.
Yes.
Okay.
Good morning all. My name is Esther Elisaria from Tanzania. I just wanted to anchor from my brother what he was trying to say. Manufacturing a product or a drug requires some research processes. And you have to start from the phase 1 to phase 4. And those processes are normally very expensive. And because we don't have much, I think the gap we have here is less investment on the research that are related to drugs. And when you have less research, it is very hard for the drug that is going to be used by the human being to penetrate into the market. And for me, I feel like as we are also pushing forward to have the drugs locally produced, we also have to invest more into the research that allows our local product to meet the global standards. So I think this is something also ECSA should critically support in terms of maybe not ECSA really, but also other partners, to also invest our capacity in terms of carrying out our local research to make sure that our products are also competitive to the market and are also meeting the global standards. So that's just something I also wanted to re-emphasize. Thank you so much.
Thank you so much. Honorable Ministers, distinguished guests, we have come to the end of this session. Thank you so much for your commitment and for your contributions. Due to the competing schedules of some of our honorable ministers,
I'm requesting that we proceed, instead of having the tea break, we proceed with the launch so that some of our honorable ministers have other commitments. So I'll consider that you have accepted my request.
Yes, yes.
I'll hand over to
Yes, Chair. They give people five minutes break.
Yeah.
That's five.
Thank you. Thank you so much, Chair. But before the launch, the Chair for ECSA Health Community has something to say. May I request the Chair? She has a quick word for us all, and then we'll proceed to the launch. Thank you.
Good morning once again. I have an announcement to make. Tomorrow during the closed meeting of the HMC approved the recommendation of the advisory committee for the preferred candidate for the position of the Director General ECSA. Fortunately, the incumbent is among us. We have written to the incumbent and he has accepted the offer. The new DG of ECSA Health Community is Dr. Ntuli Kapolokwe. Dr. Ntuli is from the Republic of Tanzania. He is currently the Director of Preventive Services in the Ministry of Health, Tanzania. You can come next to me, Doctor. The DG. Let's give him a round of applause. Today I'm not going to give him to say a few words. He will have plenty of time to do that. Instead, I will ask the Honorable Minister from the Republic of Tanzania to say a few words. Honorable Minister.
Good morning again. Honorable Chairperson, distinguished ministers, permanent secretaries, member of the Secretariat, ladies and gentlemen. It is with great pride and a deep sense of gratitude that I stand before you today to express my sincere appreciation for the brilliant work carried out by all involved in the selection process for our new DG, especially the Regional Advisory Committee and the Ministers' meeting and across the session. Honorable Chairperson, your efforts have assured that we have reached this momentous decision in a manner that reflects our shared commitment to excellence. Honorable Chairperson, allow me to bring to you the warm greetings from Her Excellency Dr. Samia Suluhu Hassan, the President of the United Republic of Tanzania, who has been a champion in regional and global collaboration and advancing health diplomacy. She has been always support all these regional initiatives, including ECSA Health Community. Honorable Chairperson, I speak today with utmost confidence for the individual we have selected as our new Director General of ECSA Health Community. Dr. Ntuli Kapologwe has long been distinguished leader and an expert of different caliber. His journey is one of exceptional, and I have no doubt that as incoming DG will prioritize the strategies outlined in ECSA Health Community Strategic Plan. His leadership, without doubt, focuses on long-term organizational goals, such as the development of the Ngaramtoni site in Arusha, where it is in Tanzania, to establish the ECSA Health Community Center for Excellence in infectious diseases, as our region is battling outbreaks and pandemic response. This will help to enhance the feasibility of ECSA Health Community and attract more partnership. He will drive a greater regional and global collaborations and ensure the ECSA HC remains competitive, impactful, and relevant to our member states, partners, and the community we serve. Honorable Chairperson, I had the privilege of knowing Dr. Ntuli Kapologwe for many years. Throughout his remarkable career, he has served with distinction in various roles, from primary health care to secondary care. His dedication to health and welfare has been evident in his work with the President's Office, Regional Administrative and Local Government, where he championed health, social welfare, and nutritional services. His tenure as a Director of Preventive Health Services in my ministry, or my Ministry of Health, along with leadership of our focal point of international and global health affairs, he has made an establishment of numerous partnership and collaboration that have strengthening Tanzania's presence in regional and global stage. Dr. Kapologwe has always a successful leader. Maybe I will repeat it here again. Dr. Kapologwe has always been a successful leader, and his contribution to our country has been invaluable. Honorable Chairperson, Tanzania is proud to offer Dr. Ntuli Kapologwe's talent and expertise to serve the ECSA Health Community and beyond. We have no doubt that his leadership will build on the foundations laid by his predecessors, driving the transformation of our community into one that is more competitive, impactful, and capable of addressing the health challenges of our region and beyond. I take this opportunity to reiterate Tanzania's unwavering commitment to support Dr. Kapologwe in his new role. We will stand by him and his team, I mean the Secretariat, as they work to elevate ECSA Health Community to new heights. I also kindly ask him, Dr. Kapologwe, to continue supporting my fellow ministers and the member state so that together we can achieve our shared goals and ensure healthier, more prosperous for future for all. Thank you. Ziko mkwambili, asanteni sana.
Thank you so much. Thank you very much. Thank you so much. Thank you so much. Thank you so much, and congratulations, Dr. Mtuli Kapologe. Thank you so much. And now, as it was announced earlier, that we'll proceed into the next activity, the launch of the 10-year strategic plan. I would like to humbly request all ministers and heads of delegations to come forward here. The honorable ministers and heads of delegation to come forward so that we perform the next assignment. I will also ask World Bank to represent all the partners. World Bank to represent all the partners. I would like to request the chair, ECSA HC, and the host, Malawi, to hold these pairs of scissors to cut the ribbon. Let me just mention also that because it's a joyous occasion, we're going to have some fireworks here. Please don't get scared with the fireworks, part of the celebration as the ribbon is being cut as we are celebrating. Thank you. Thank you. Now it's time for a photo shoot. Let's also allow the professional photographers to take the best shot. Thank you. Are we done? Thank you so much. Thank you very much. Thank you so much. You can take seats. And now each country, each member state is supposed to have a pack. There's a pack for each member state. Thank you. Now, because of time, we are not breaking. We need to conclude whatever is remaining. Thank you. chairing. The next one is Eswatini. I really hope we're going to shift into a higher gear because there's going to be another function in the room by the head of state. And so let's make sure we keep on time. Thank you. We will have Malawi chairing because Eswatini had to rush to the airport. Malawi will chair the session. Thank you.
Good morning, everyone. Thank you. Yeah, I'll be taking you through this session where we're going to have a partners consultation forum. As we know, partnerships have been a cornerstone for the East Central and Southern Africa health community, and in the efforts to improve the health outcomes across the region. So recognizing the pivotal role of collaboration that partners play, it was thought important that we should hold this panel session where we would want to engage our stakeholders in the ECSA HC community, particularly in terms of implementation of the recently launched strategic plan 2024 to 2034. The plan itself outlines the region's collective vision for addressing critical health challenges, strengthening health systems, and promoting equitable access to quality health care. So we would want to discuss and with our different partners that are present here and identify opportunities where they can align their resources, expertise, and initiatives to support the strategic focus that this plan is looking at and achieve the health outcomes that we desire in the region. So we have 5 panelists. If you can allow me to call to the front, Yamanya Tembo from REACT, Paul Review from University of York, Natalie Lemugala from PATH, Felix Maonera from OACPS, and Peter Okwero from the World Bank. Please join me in front. Thank you. It's going down. Okay. Yeah. I will stand. It's fine. I think it should go up a bit. Yeah. So in the interest of time, we'll go straight to our questions for discussion, and I will start with Yamanya with REACT. How can we improve cross-sectoral collaboration between governments, NGOs, private sector entities, and multilateral organizations to address regional health priorities and enhance health outcomes? And in addition, what successful partnership models have been implemented and what lessons can we learn from them, from your perspective?
Yeah, so I think
the way that we could improve cross-sectoral collaboration would require a combination of three things, and that would be strategic coordination, policy alignment, and resource mobilization. I think just looking into these different areas, the first thing would be to try and strengthen governance and coordination mechanisms, which would entail trying to establish a regional health coordinating forum. And I think in this regard, ECSA HC is probably very well placed within the region to play a key role in that. Other things that we could do under the governance would be to strengthen policies and strategies and ensure that our policies are harmonized across the region. This could be across sectors such as agriculture, environment, and trade. Wherever there is policies that hinge on each other in these different sectors. Then another thing would be to ensure that we are defining roles and responsibilities to avoid duplication of efforts. We need to move to a point where we are synergizing efforts and not duplicating efforts within the sector and across sectors as well. Other than that, I think another thing that's important is to enhance data sharing and joint research, which would mean creating regional health information systems that will allow us to share data across, and also having in place a policy that will govern this data sharing across the region. Also, facilitating joint research initiatives would be important to encourage cross-sectoral and international research collaborations. Furthermore, I think capacity building and workforce development would be important, and I think the region has already been doing quite a lot in it. ECSA has been explaining, to us how their colleges have been functioning across the region, and I think this needs to be strengthened to include not only the human health sector, but include the animal health sector and the environmental health sector. We also need to strengthen institutional capacities to support governments and organizations in building resilient health systems and emergency preparedness. Then I think we need to leverage on our multilateral organizations and our regional economic communities, aligning with global and regional health agendas, ensuring that the regional health priorities align with things like the WHO, the AU, ECOWAS as well, and have frameworks that maximize this impact across the region. Lastly, I think promoting community and civil society involvement would be very important in this regard. Strengthening community-based health programs, like we have spoken, I think many of the countries have been speaking about their different approaches to community-based programs, having community health promoters or health workers in the area to just strengthen the reach to our communities. And then advocate for policy and legal reforms, working with the civil society to push for policies that enhance health. And I think we have spoken during this conference about the some of the different areas that have been that where we have leveraged this kind of support and coordination. I think Zimbabwe gave a great presentation about their cross-border TB program that I think we can really learn from in terms of sharing data across the different countries, enhancing coordination across the government sectors, and across our borders. So I think that those are things that we can learn. Thank you.
Thank you very much, Yamanya. Very important points there, highlighting the importance of governance as well as policies, strengthening our policies and data sharing, not just within countries across the sectors, but also cross-border. And of course, not forgetting community involvement. So I will move on now to Paul. In terms of financing mechanisms, what innovative financing mechanisms can be leveraged to to ensure sustainable funding for implementation of the ECSA strategic plan and other regional priorities. Specifically, how can we package the health gaps in a manner that we can convince policymakers through economic modeling?
Okay, thank you, Chair. So it's a difficult question to answer. It's always challenging to try to generate more funding for a cause. It's not an easy task, but I'll present some thoughts on the question. And I'll speak especially from my position as a researcher, as a university professor who's been active in revenue generation for research and for health programmes, including largely with ECSA. And as a researcher, I'd like to emphasise, in reference to funding generation, the strong complementarities between the research community and the policy community, which is represented here at the highest level by Ministers of Health. Now, we researchers generate evidence, but we need relationships with policymakers for that evidence to have meaning and to generate value and to lead to population health. Policymakers, for their part, require evidence to inform the decisions that they make. The better decisions are made, the more population health will improve. So, although we often exist in separate worlds, policymakers and researchers, I'd like to contend that we can achieve lots by coming together in shared endeavour to improve decision making and to improve population health. And it's in this that I think ECSA has is in an ideal position, in a unique position actually, in being able to bridge the worlds of research and policy at scale across the member states of ECSA and even more widely across the continent and beyond. And this has huge value and it has huge potential to generate funding for the delivery of the strategic plan. And I think all of the sessions at this conference have helped to demonstrate that value proposition that ECSA offers to a range of external funders. It can bring communities together, including community representatives, but in this case particularly thinking of researchers and policymakers, to make better decisions which can have a seismic effect on improving population health in all of the areas which have been addressed in this conference and others, NTDs, AMR and all areas of health. And I'd just like to reflect upon the presentation by Edward Katika yesterday, who highlighted how the research and policy communities have come together at a regional level within ECSA, through the ECSA Health Economics Community of Practice, and also at national levels in Malawi, in Uganda, in Eswatini and elsewhere. And my contention that by bringing policy and research communities together, we can offer an attractive proposition to funders has been proved through the work that Edward has led. The units in Malawi and Uganda and the ECSA community have received funding from innovative funders, from research councils from across the world, but also from new funders in the global health sphere, including, for instance, from Gulf states and from philanthropists. So, who are the funders who we could approach and seek support in delivery of ECSA's strategic plan? Well, it's traditional research councils. In my own country, in the UK, that's represented, for instance, by the National Institute for Health Research, which spends tens of millions each year on health in Africa, often not guided by the needs of policymakers. So we can affect that, and we can seek the support of such funders to channel their funds in ways that ECSA highlights most, the MRC in South Africa, and also new pan-continental arrangements such as those led by the African Union. It includes donors who I think ECSA has been successful in engaging, such as the World Bank, who are here, and the Global Fund and others. But a large and growing sector, which I think can support ECSA a lot, is philanthropy. Philanthropy is growing across the world, and philanthropists in particular want to ensure that they spend their available funds to greatest gain. ECSA, through the combination of research, engaging the mandates of policymakers and support programme delivery, can really be central in making an attractive proposition to philanthropists. So what do donors want? They want evidence of potential for impact, and primarily they want to ensure that their funds are used to the largest impact possible. This is really an issue of cost effectiveness. They want to ensure that their funds are being used cost effectively. So the second part of the question related to the role of modelling and health economics. And the great value in health economics and modelling is that it can simulate alternative scenarios before those scenarios are delivered in practice. And through simulating those scenarios, it can demonstrate if we tackle NTDs, if we tackle AMR, if we support domestic production and regional cooperation, we can make a difference for population health. So it's using the tools of modelling and health economics that we can demonstrate benefit and then hence draw resources to our agenda of ECSA's strategic plan. And finally, there's been quite a lot discussed during this conference about making our case better to our ministries of finance and to other bodies for which health is not the primary concern. So it is the case for more money for health, attracting resources into the health sector as opposed to other sectors. And we've got a lot we can do in this regard. Often we think in terms of diseases, interventions, in terms of health. Ministries of finance and other economic bodies think in terms of fiscal management, economic growth and the like. And we can and we need to better get across the message that health is not a cost, it's an investment. Because if you spend on the health sector, that can support domestic production, it pays healthcare workers' salaries, there are economic multiplier effects. And there's evidence for this, but we need to put that evidence to our ministries of finance and other bodies to draw more resources into health and help ECSA and its members deliver on its plan. Thank you.
Thank you very much. Important points there indeed, highlighting the need for us to deliver cost-effective interventions from our research and making sure that we're translating the research to policy so that our policies are actually evidence-based. And of course, we had asked about financing mechanisms and identifying funders to fund this research and making sure that the research is impactful or ensure that the funding is sustainable. And of course, importantly, health is an investment. So if we can package our ask in a way that health is an investment, I think we'll be able to get sustainable funding for our health priorities. So moving away from financial support, beyond financial support, what other forms of contributions can partners provide to support ECSA HC, but also the member states to strengthen the health systems and implement health priorities that have been indicated in the strategic plan for ECSA HC? Natalie Lee Mugala, please.
Yeah. Thank you very much for that question. And first of all, I want to express my sincere gratitude for being given an opportunity to participate on this panel. And before I actually answer your question, I'd like to share a little bit about my organization, PATH. So PATH is a global non-profit organization which is dedicated to achieving health equity. And we have more than 40 years of experience forging multi-sectoral partnerships across science, economics, technology, advocacy, and a lot of other specialties. Our mission is actually to advance health equity through partnerships and innovation, and we work across what we call 5 pillars, and this is drugs, vaccines, diagnostic services, and health systems and services. Now, what is unique about PATH is actually our end-to-end capabilities. As an organization globally, we actually have capabilities right from conceptualization of ideas, research, up to implementation. And really, at our core, we do believe that better health moves humanity forward. And when people are healthy, then they are able to be productive. Children are able to go to school and obviously build better and more prosperous lives. So that's really important for us. And this is why we actually focus on addressing the challenges that really impact the most challenged populations globally. Now, coming back to your question, beyond financial support, what other forms of contributions can partners like ourselves provide to support ECSA and member states in strengthening health systems and implementing the health priorities as outlined in the recently launched strategic plan? So first and foremost, we all recognize that it's really important to note that partnerships are key in whatever that we do. And for us, I think really, acknowledging the fact that partnership and collaboration have been called out as key priority in this strategic plan. And this is definitely important to allow for collaboration in program implementation, knowledge sharing, and engagement at various levels. So basically, and these initiatives are important because, I think we've heard throughout the 3 days that no country, no institution can do it alone. So partnerships are core to achieving, the aspiration of what we would like to achieve in the health sector. Now, specifically coming to your question as with regards what partners like ourselves, like PATH, can contribute, I have outlined a couple of areas, and perhaps this is not even exhaustive of what we can actually contribute. So the first is on program design and implementation. Now, ECSA, can actually partner with NGOs and other partners like ourselves to design and implement targeted programs that actually address healthcare gaps in the underserved regions in support of member states. Now, we've heard throughout these last days discussions around priority areas such as infectious diseases, non-infectious diseases, neglected tropical diseases, mental health, and other areas of priority, including, the presentations that we just had on local manufacturing and the importance for building capacity at the local level. So these are all areas where, NGOs or partners like ourselves can actually support ECSA and member states through technical assistance. And like I said, PATH in particular has got really diverse capabilities in all these areas. And, these areas where we could potentially, work together and collaborate and support in advancing, program design and implementation. The other area is actually on capacity building for health system strengthening. And here in particular, I want to call out the fact that partners like ourselves can actually support capacity building, especially through the use of, say, digital tools and technology and innovation. And again, I think as we've been discussing in the last 3 days, we recognize that there's a lot that we do, but we need to be much more innovative. And we also need to leverage on, tools such as digital tools, AI, to really strengthen some of our health systems, for instance, so that they are robust and that they're resilient. And I think we have, all these tools on hand. It's about application. It's about building the capacity to actually be able to utilize those tools. And this is an area where a lot of partners like ourselves, again, have got the potential to support ECSA and member states. We could also work together and support in areas like policy advocacy and health financing. Again, you agree with me that health financing has been a focus point of discussion throughout the 3 days. The importance of having sustainable financing to be able to support all the interventions to be able to support quality service, healthcare service provision. So NGOs and other partners like PATH can actually play a very critical role in advocating for policies that advance health equity and and equitable health spending and resource allocation. And this is something that we can also, support the ECSA and member states. We can also support in the area of healthcare building capacity in healthcare financing itself, which, like I said, has been a recurring theme in this in this meeting. And this is again to ensure that we have sustainable and resilient health systems. Another area which I thought I would call out is on knowledge management, and in particular, data collection, monitoring, and even data generation. I think in the area of research and development, again, this is a capacity that most partners do come with, and it would also go a long way to ensuring that we have the evidence that, member states and ECSA that can utilize actually to be able to inform decisions and also to inform where investments should go. So again, this is a capacity where, NGOs can actually bring. The other area is I think I talked about partners being quite diverse in their capabilities, but also diverse in terms of the presence. And here I'd like to call out the issue that partners like ourselves have got actually extensive local presence. And so it presents us really well to be able to engage at every level in the different communities and countries where we work. For instance, if we look at PATH works in several of the member states that are actually around in the ECSA health community, but even beyond. And most partners are trusted partners. Most of partners are trusted with the ministries of health that they work, and so again, it places them well to be able to work with the various countries and the ministries. So again, that is a strength that partners can come with. We also, I'd like to call out the fact that, like PATH, we have implemented model that actually promote local community engagement and locally led solutions. And again, I think as we've been talking, it's come out over and over again, the need to design approaches and approaches that are actually taking into consideration what are the local needs and having local communities at the core of designing and conceptualizing those approaches within the health sector. And we have models that can actually promote that and ensure that is actually happening. So in conclusion, beyond financial support, partners like PATH do bring strong technical expertise, innovative solutions, and a strong local presence that can actually support ECSA, health community and member states in achieving the ambitious goals that are outlined in the current strategic plan. And I must end by saying that as partners, and I think I speak for most partners, we are all really committed to working very collaboratively to strengthen health systems, advance health equity, and improve health outcomes across the entire region. Thank you very much.
Thank you very much, PATH. Thank you for ably elaborating the areas, the potential areas from innovation, digital tools, capacity building, program design. I'm sure ECSA has taken note, and so have the member states. And we'll be reaching out not just to you, PATH, but to all the partners. We'll move on now to Felix Maonera from Organization of African, Caribbean, and Pacific States. How can we establish a structured mechanism for ongoing engagement, monitoring, and evaluation of partnership commitments? And what governance structures should be in place to ensure there is accountability and transparency in partnerships?
Thank you. I have a short answer to that. I'm not a very big fan of creating new mechanisms. But before I come to that, let me explain a bit what the OACPS is. This is the Organization of African, Caribbean, and Pacific States, 79 countries across 3 continents, 48 from Africa, 16 from the Caribbean, and 15 from the Pacific. So our strong point is that we can give our partners a single entry point into 79 countries across 3 continents. And this is what we have been providing to our partners, and this is why they found us to be an attractive cooperating partner. Now, coming back to your questions, monitoring and evaluation, transparency, accountability, do we need to put new structures in place? I don't think so. And this is why I say this. Our biggest cooperating partner is the OACPS, is the EU, and we have been cooperating with them since 1975. What we have discovered in the Secretariat is that the instruments we conclude with them and the way we are supposed to operate or spend their monies have self-contained evaluation and monitoring mechanism. So as a Secretariat, when we do our work, we need to report back to our member states who monitor us. And when we release funds to member states, we need them to report back to us, so we also monitor them. And our biggest funder, the EU, will be asking for reports, will be monitoring us on an ongoing basis. And for those of you who have received funds from the EU, you will be aware that you really have to account for every cent. If you don't do that, then there's no chance of you receiving the next tranche or even coming back for more funds. As head of the Geneva office of the Secretariat, the question they keep asking me, and this is a monitoring question in my view, they ask me, we have been training your people since 1975. We have capacitated many of your people, but can you tell me where these people are? And I can tell you most times I don't have an answer. I know where some of the people are, but in most instances I have no idea. So when we go back asking for further funding for capacity building, they've already monitored us and evaluated that they gave us more money than what we probably need now. And to put things into perspective, we have just received funding from an organization called the Global Center for Health, Diplomacy and Inclusivity. It is based in Geneva. This organization is the implementing arm of another organization called HEDPAC, which is the Health Development Partnership for Africa and the Caribbean, which is championed by President Mia Mottley of Barbados, President Ali of Guyana, and President Kagame of Rwanda, supported by Dr. Tedros. We got this funding again to build capacity, the capacity of our member states to engage in the WHO and in the Human Rights Council, and to make sure that our embassies and delegates in Geneva establish links to their capitals, because sometimes we have seen if they need information on something, it might not come to them as fast as they want it. So within that project also, there's an element of self-monitoring and evaluation. I have to report to the funders every 6 months. They in turn have to go back to the presidents and tell them what we are doing and what we have achieved. And of course, we know if we don't achieve the things that are supposed to be achieved, then no further funding will be coming. And those of you who work with ministers, in my previous life, I used to work also with a minister, and the Ministry of Foreign Affairs of Zimbabwe. You know by the time the minister asks you why you haven't done anything, you know by that time already why you haven't done it. And sometimes it might be too late for you to even come up with excuses. So that's an element of self-monitoring that I'm talking about. You don't need anybody to come to you to tell you why you haven't done anything, or why you haven't done it, why you have done it badly, or why you have misspent money, because you know these things yourself the moment they happen. So in conclusion, I would simply say, if you are discharging the mandate that's been given to you, you don't need a separate mechanism for monitoring and evaluation for you to be able to do what you are supposed to do. So I'll just say, while there's a desire sometimes to put in place new things, we need not lose in the shuffle the fact that we have mechanisms in place which, if they work properly, they can give us the monitoring and evaluation that we want. They can give us the accountability and the transparency that we need. I thank you.
Thank you. Thank you very much, Felix. Indeed, a well-deserved hand. Thank you for highlighting the importance of using the existing structures, and also, importantly, self-monitoring as we are implementing, to ensure that we are accountable to all of our for all of our actions. I'll now move to the World Bank. Peter, the World Bank has been a great partner to ECSA Health Community for more than 10 years. What are the key areas where partnerships can have the greatest impact on strengthening health systems in the ECSA region? And also, how do you see the World Bank likely to continue to support ECSA, HC, and the member states in advancing the critical regional priorities? Thank you.
Okay, thank you. I think let me just reflect a bit. In responding to this, what I'll try to do is talk briefly about really the importance of partnerships and possible areas that I'll try to flesh out. Then two, reflect a bit about how the bank operates, because it's important to understand the bank. Otherwise, there is no way you can have a partnership. And then lastly, I will talk about, what I see as the way forward, not necessarily whether the bank is going to continue supporting ECSA. I think that will be dependent on the two. So first, on the overall area of partnerships, I think for me, it's important to appreciate that one, partnerships are important. You'll need it, we all need it to be able to do whatever we want to do. But fundamentally, we need to be more strategic in the way we enter all these partnerships. So I'm really expecting ECSA to know its partners very well. I also know that countries have partnerships across all levels. There are those who are funders, there are those who are implementers, there are those who are critical for implementing, who are not necessarily in health, like ministries of finance and all the rest. So let's all appreciate really the importance of partnership. Now, as we try to delve down on really those areas, there are two things which come out to me. One is thinking about, areas which promote regional collaboration or ability to implement regional activities. And I think ECSA is very good in that. I think ECSA needs to continue working on supporting countries in implementing activities which are of a regional scope. And there are several of them. I can't mention, but the key ones that come in mind, when you talk about health emergencies, and I'm talking about health emergencies in general, you will always need to be able to relate and work with other countries. So building partnerships, and that ensure that you are able to address activities at a regional level, and also be able to address some of them at the cross-border level are going to be important. So that is one area I really want to highlight. Now, there are also activities which are national, but for which there are regional imperatives, which are key. And I think this is where ECSA can work with the countries in addressing some of those bottlenecks. There could be local bottlenecks, but there are experiences from different countries which can be brought on board. So ability to be able to bring countries to share experiences, but also to work towards common problems will be critical. And I just want to highlight a few. I think one key area that really stands out to me is this whole idea about human resources for health. You know, there are all these colleges in ECSA. The extent to which these colleges are currently being used to adequately develop, the professions in the countries is something I would definitely believe that ECSA can build upon. Now, in health financing, most countries are talking about health insurance. They are working towards certainly more in ensuring that they develop different aspects. Now, understanding, implementation, there are all these experiences. The question now is, how do we get countries to actually think about these things? So within the health financing space, it will be important for ECSA to actually identify some of those core areas. The one which is new, and ECSA has worked on, but I think our IGAD colleague talked about it, is the whole idea of pharmaceutical manufacturing and regulation. This is a new area for the Ministries of Health. And if we're going to really take this up, the Ministries of Health will need support. They need to work together as a team. And it will be critical that the regional entities are able to work with the ministries, not just bringing Ministries of Health. You need the regulators, you need the Ministries of Trade, and you need to bring in sometimes the Ministries of Finance for people to appreciate. You know, because manufacturing is a private sector entity. You are not talking about the government, you're talking about private sector. And there are areas which are crucial, like GMPs. If you talk to many of the manufacturers, they are concerned about costs. So is there something that government can do to help alleviate some of these costs initially, so that, you adopt good manufacturing practices? The last one then, accreditation. ECSA has had very good experience on supporting laboratory accreditation in this region. In 2010, when the bank started working with ECSA, if you talk to people at that time that labs would be appreciated in this region, everybody would laugh. But it was the dedication of a few people who really pursued this idea, and it was also good that we had a regional entity like ECSA, who was then able to work with the Africa Society for Lab Managers and bring in the technical experts in our countries that understand laboratory science. Today we see what has taken place, and we just realize that we don't realize the work, the level of input which different people put. And I want to ask ECSA, is it possible to extend this, this experience to build accreditation beyond labs? Because I think what has transformed labs in this region was the element of SLIPTA and ensuring that everybody wanted to be accredited. So we could do that for hospitals, we could do it for some of the training institutions. So I would say that. Then the last thing is promoting innovation. We have so many innovations coming. Can ECSA step in and support this through communities of practice? You have these communities of practice, which bring experts from across the region. Can we use them? So then my second short comment is, how does the bank work? The bank is a bank first. So we relate with the Minister of Finance. Our interlocutor when it comes to government is the Minister of Finance. And it's important that whoever wants to engage with the World Bank really talks to their Minister of Finance, without which it's very difficult to have an engagement. 2, the bank does provide grants as well as loans. But besides that, we also do provide support through TA and analytics. The one thing which is unique about people who work in the health sector is they always get lost when we talk about loans from the World Bank. And I just want to share this because I'm a health worker, but I've done different courses in management, health economics, and all the rest. I think what the ministries of health need, when you are looking for funds, do not be lost in terms of saying, is it a loan, is it a grant? Because every time I've engaged with ministers of health, that is the first question they ask me. I always tell them that that question is irrelevant. That question should be answered by the Minister of Finance. When you go to get money from finance, get money from finance. Don't spend time thinking that is it a loan or a grant. If you understand how budgets are financed in government, you know that every 2 weeks in this region, they issue bonds. Bonds are essentially governments getting loans. Governments go and talk to all these banks. They know how much money they'll get from the bank in the next 3 years. They know how much they'll get from Africa Development Bank. So for you, concentrate on trying to get the money without getting lost in terms of, is this a grant, is this what? Because finance will give you money on the basis of their own understanding of their fiscal space and sustainability requirements. So I just thought I'd bring that out so that we all know that this money is open. It is up to you to go to and have a discussion with finance. So lastly then, how do I see the future in our relationship with ECSA? You know, with ECSA we started working actually in 2010. I'm among the people who have worked with ECSA longest here, and I know them very well. So one, we have done a great job together. We have had several projects. ECSA has managed maybe more than 6 or 7 projects of the World Bank, including analytics. So there's a strong partnership which has evolved. Now, if you asked me going forward, what should we do? I think I want ECSA to reflect on how these monies have come and what ECSA needs to do to ensure that these resources continue. One of the things I just want to put forward, in all these cases, actually, the bank has been the initiator. And I want to see a situation where ECSA really starts promoting itself beyond technical people like us. I work more on a technical level. Is there a way that ECSA starts promoting itself in engaging Ministers of Finance across our regions, making sure that they actually work with some of our key directors in this region so that you are known? Now that we have the new DG, I think one of his key roles would be, you know, to reposition ECSA, to be seen as an agent. I raise this because in the last project which we just worked on, you know, when I proposed ECSA that we want ECSA to be the regional partner, other partners within the region were saying, but who is ECSA? ECSA is known only in the health sector. If ECSA is going to be a key partner that works, that really supports health, they need to see themselves as people supporting health beyond the ministries of health. The ministers of health are the owners, but in terms of having influence, have influence beyond the Ministry of Health. Now, our current support for ECSA goes up to 2029, so there's a lot of room. I want us to start thinking of going beyond pandemics and health emergencies. I really want us to start thinking of which other new areas do we get on board for this partnership. So this is what I'm really calling. I'm not going to be the one to direct ECSA which areas they want to, but I really feel that it is time to go beyond pandemics because this is what we have worked on. And finally, as I conclude, I just want to encourage that as we think of this partnership going forward, I really want ECSA to take some time to study some of the grants that we have within the bank. We have the pandemic fund, we have the global financing facility, and we have, I think, 3 others, including several which are in the other sectors. Why I'm raising this because once you understand some of these funding arrangements, then you can actually engage the bank much more effectively. So, Madam Chair, let me stop here.
Thank you very much. The World Bank, I'm sure ECSA has taken note and will reflect, and member states, we've also noted, and we look forward to continued support, whether through grants or loans from the World Bank. In the interest of time, we need to conclude. And I would like to thank you, our esteemed panelists, for sharing your insights. I know that maybe there may be some questions, some comments from the audience. Please feel free to engage with the panelists over lunch. And also beyond today, I know that we'll be able to engage further. Let's give our panelists another round of applause. And then I will hand over to Mr. Chikumbe to take us through the closing ceremony. Thank you.
Thank you. Thank you so much, Chair of the session. A big round of applause to the Chair and the rest of the presenters today. Thank you so much. And now, ladies and gentlemen, it has been a long day, even though it's half day, a long 3 days. Now it's time for closing. We will now, as we get into this session, we'll start with the Acting Director General, ECSA Health Community, to come and say a few remarks. Thank you.
Yes. Honorable Ministers, Heads of Delegation, distinguished ladies and gentlemen, good afternoon. Yes, I want to first express on behalf of the Secretariat our appreciation for the support from the Republic of Malawi, as well as the member states, their participation in this conference, and also to appreciate the contributions, which I believe were quite excellent. There's a lot that we learned about in the past 2.5 days. I want to thank each and every one of you who actually contributed and made this conference a success. The team that has been working on the resolutions, unfortunately due to time, we are not able to present the resolutions to you, honorable ministers and heads of delegation, but they are ready. And we are going to share them with you. And the plan is that these resolutions will be presented again to you in the upcoming meeting in Geneva for your ratification. So we are going to share them, take time to look at them, send us your comments, and then during the meeting in Geneva, the ministers will look at them and then ratify them so that they can be implemented. Our role will be to make sure that we have a framework to implement, to monitor the implementation of these resolutions. I also want to mention, honorable ministers, distinguished ladies and gentlemen, that one of the key decisions taken by the ministers in the closed session was the approval of the Best Practices Forum theme and sub-themes. So the Best Practices Forum is going to be held in August of this year, and the dates will be 5th to 7th of August 2025, and it's going to be held in Arusha. We will soon sending out the announcement, and we request that, of course, you make your submissions in terms of abstracts, as well as best practices that you may wish to share with the rest of us. So as I end, let me again pass my appreciation on behalf of the whole team from the Secretariat, and thank you very much for making this conference a success. Thank you.
Much appreciated to you, Acting Director General. Now, Honorable Ministers, Heads of Delegation, now I would like to hear from the Chair of the Advisory Committee to ECSA.
Honorable Ministers and Heads of Delegations, ladies and gentlemen, good afternoon. It has indeed been a long 3 days, and I don't intend to take much of your time. Let me congratulate the DG, the new DG. While doing that, let me appreciate the work that Mr. Sbanza did in his capacity as acting DG. I always called him DG. I said in the hospital, suspected TB is treated as TB. So acting DG is a DG. We appreciate the work that you have done. It's not easy to manage a transition up to the time that we have hired a new CEO. Before him, we had Professor Yosua Dambisia. He also did quite a good job. Those of you that understand ECSA, 10 years ago, it had almost drowned. But he and his team did a very good job to be where we are. And let me thank the team from Malawi, Dr. Joshua and your committee did a very good job. We appreciate, we don't take it for granted. And let me thank all of you. Let me thank all of you, our delegates from all over the ECSA region, the media, implementing partners for being with us. Today you've been very patient, no tea, no lunch. It is coming soon. With those remarks, wishing you all the best as you travel back home. Thank you.
Thank you so much, Chair, Advisory Committee to the ECSA. The meeting was taking place in the warm heart of Africa, and therefore I'd like to call upon the hosts, Honorable Minister for Malawi, Minister of Health. Thank you.
Thank you so much, Adrian. The chairperson representing the Honorable Minister of Lesotho, all heads of delegations. I also recognize my fellow cabinet ministers, and I have my sister from Uganda. Thank you so much for making it to Malawi. All senior government officials, chairperson of advisory committee, who also happens to be our secretary for health under the ministry, representatives from UNHCR's collaborating and development partners, distinguished ladies and gentlemen, good afternoon. It has been a long day, a long morning. The sugar levels must be very low, but it is a good time to fast, you know. We have got so many things to fast for. The continuation of the good rains, the success of ECSA, you know, we have to commit our new DG, you know, there's so many things which we have to fast for, pray for. But on behalf of all of us in Malawi, on behalf of our state president, it's just to say thank you so much to the leadership of ECSA for making it that the conference should be here in Malawi this year. I know it is done on a rotational basis, but for us, it is a great honor. You know, for us, Malawi, we have been through so many challenges. So there isn't any time where like we are saying, no, now we are fully comfortable to do whatever, you know, but still, you know, you took a risk to say, no, we still got Malawi. And for that, we are so grateful. to leadership of ECSA. Let me also express our sincere gratitude to all of you for making it. ECSA, they could have chosen the venue, but if you had not attended, it was going to be a flop. But it has been a very, very successful conference. The contributions, very interactive, because sometimes these conferences, you sleep, you're always dozing, but I've not seen anyone dozing in here. We have all been so alert. Despite the sugar levels being low, but all of us who have been so alert, and it has been so inspiring. We have had great contributions, especially from my brother Mauritius. Mauritius, you should always come. We should not miss these conferences. You bring in a new perspective, because most of us want to be politically correct all the time, as ministers, but you bring in some freshness. It has been so wonderful to host all of you, and really it's just to wish you well as we are traveling back, and I really pray that God, grants us all a travel message as we go back, and we're looking forward to meeting again, whether it's in Geneva or wherever you call us, we are going to be there. But wish you so much success. I've been so much inspired. I know the future of ECSA, it has not even begun. The future looks even much brighter. There are so many things which we can achieve together as a region. So with these few remarks, I really wish you all the best and travel well. God bless you all.
Thank you so much, Honorable Minister. And now I would like to request the representative of the chair to come and close the session. Thank you.
Good afternoon once again. Honorable Ministers, distinguished delegates, development and collaborating partners, we have come to the end of the Health Ministers Conference, and we have had an intense meeting in these 3 days, whereby we were discussing pertinent issues affecting our health systems. We have heard from member states about the significant strides they have made in tackling disease burdens that affect our communities. Last year, we were celebrating 50 years of ECSA existence. And now looking ahead, post the 50 years, the impact of ECSA health community should be felt. Let us be visible and vigilant. Even though the region still has some challenges, let's work together to strengthen our health systems to cater for the needs of our people in our respective countries. We need to invest in our human resources. We need to capacitate our human resources. We need to have our own specialists. We also have to equip our health facilities with the requisite medical equipment to reduce dependence on other countries or other regions. We have made a commitment to inject more domestic financing into our health systems to reduce dependency on external funding. Let's go and impress upon our governments that we need capital to get the best health outcomes. We have been told that NCDs are at epidemic levels and they strain our health systems. And therefore, there is an urgent need to accelerate implementation of NCD best-based plan. And we were also enlightened about mental health challenges among the youth. And at this juncture, I would like to express my appreciation for the unwavering support we have received and that we'll continue to receive from our collaborative and development partners. Their commitment and partnership are highly valued as we work together to address the health challenges that persist in our region. I would also like to extend my gratitude to the government and the people of Malawi for the hospitality in hosting this important gathering. This involves a lot of dedication and sleepless nights to organize a conference of this magnitude, and it drains the ministries financially and otherwise. Once again, thank you, Honorable Minister, for hosting the HMC. As you are now aware, the closed meeting of the HMC approved the recommendation from the AC about the preferred candidate for the position of DG, and the position has been vacant from August last year following the departure of Professor Yoswa. And I would like to take this opportunity to thank the Acting Director General for holding the fort while recruitment was in progress. Shoba Fanas. I would also like to inform the meeting that the government of Mauritius has agreed to host the 76th HMC, and full details will follow in due course. In conclusion, I would like to thank all the participants for their fruitful and productive deliberations. I would also like to thank honorable ministers who took time out of their busy schedules to be in this meeting. Without them, this meeting will not be a success. And once again, I would like to thank the government of Malawi for hosting this meeting. I would also like to appreciate the contribution of ECSA Secretariat in the preparations for this meeting. And with these remarks, I wish to declare the 74th Health Minister Conference officially closed. Thank you.
Thank you very much, Chair. The Chair, ECSA HC, 74th Conference, all honorable ministers and heads of delegation, the Chair, ECSA Advisory Committee, Dr. Samson Ndoro, also Secretary for Health, Malawi, the Acting Director General, Mr. Sibusiso Sibanze, and the whole Secretariat, all government officials present here, all our partners also present here, distinguished guests, ladies and gentlemen, this marks the end of the 74th session of the ECSA Health Community Conference held here at BICC in Lilongwe. We thank you so much for sparing the time. Two announcements before I request for a closing prayer. The first one is that those that are able to travel to the lake, to Salima, please, as you walk out, register with Secretariat, because we would want to know for logistical arrangements. So all those that wish to travel to see the lake, please register as you walk out of the room. The second one is about a lost item. There was a blue plastic bag that was left in the room yesterday. So if there's anyone who is keeping it, please surrender it to Secretariat. I'm told there was some cash in the plastic bag. So please, if anyone is keeping, leave it with the Secretariat. Thank you so much. Last but not least, let me request once again Sister Lilian Mwape, who opened this morning with a word of prayer, to close this with the same. Thank you so much. And after that, we are all invited for lunch. Thank you.
Good afternoon. I don't know how I'm going to pray for the guests of honor from Uganda. She mentioned she's a Muslim. Thank you. Shall we pray? King of glory, we want to glorify your name for making this event a success. Indeed, O Master, we want to glorify you because you have done tremendous things in our lives. And even in our region, you still continue working. We've seen your power and your mighty. Continue blessing the ECSA region. Continue giving us the grace to overcome our challenges. As we go back home, be our Savior, be our protector. Bless each and every member who came, who dedicated their time to improve the service. In Jesus' name we pray with thanksgiving in our hearts. Amen.
taking photos.